Good morning. Good morning, everyone. Um, the hearing of the Senate Blue Ribbon Committee conducting an inquiry in aid of legislation into the reported suspicious claims of hospitals and clinics with PhilHealth is hereby called to order. I'd like to acknowledge the resource persons. For PhilHealth, of course, the President, Attorney Alex Padilla. Good morning, sir.
Good morning po. Good morning po.
The Head Executive Staff of the Department of Health and the President of Philippine Eye Bank, Dr. Dominga B. Padilla. Good morning, ma'am.
Good morning.
Head of the Internal Audit of PhilHealth, Dr. Louis So.
Morning, sir.
Morning. Chairman, Board of Medicines, PRC, Philippine Professional Regulatory Commission, Dr. Miguel Noche Jr. Good morning, sir.
Good morning, sir.
Representing the Pacific Eye Institute, Dr. David Harold Gosengfiao. Good morning.
Good morning po.
We have also Dr. Christopher Barasi. Are you around?
Yes, sir. Good morning, Mr. Senator.
Morning. Dr. Brian Ongkiang Kok.
Good morning, Your Honor.
Good morning. Dr. Silvino Richard Cabrera.
Good morning, Your Honor.
Good morning. Quezon City Eye Center, Dr. Raymond Evangelista. Good morning. Dr. Romel A. Yadao. Morning. Okay. Dr. Alan Valdez. Are you around? Yes. Good morning. Dr. Joselito Joel Castro Jr. Are you around? Okay, you're around. Good morning. From the Boro Medical Care Institute, Dr. Azalea May Heredia.
Good morning.
Morning. Sergio, the Chief Executive Officer and the Chief Operating Officer, Mr. Sergio Araneta.
Good morning, Your Honor.
Morning. Meron po tayong mga pasyente na nandito, si Mr. Romeo Fernando, magandang umaga po, at Mr. Bonifacio Martinez, good morning po. And we also have the Philippine Academy of Ophthalmology, Dr. Margarita Latluna. Are you around?
Good morning, Your Honor.
There you are. Dito ako nakatingin. Good morning. And Dr. Maria Victoria Rondaris.
Good morning, Your Honor.
Yes, good morning. Okay. Sa last hearing, tinalakay natin yung pananagutan ng roles at saka pananagutan ng mga institusyon vis-a-vis yung mga doktor. Maraming issues. Meron nagsasabi na dapat ihiwalay natin yung pananagutan ng doktor at saka yung institusyon. Meron naman nagsabi, ayon sa Korte Suprema, na joint and several. Ibig sabihin, kung anong pananagutan ng doktor, yun din ang pananagutan ng institusyon. Merong tinalakay rin natin yung practice ng paghahakot o seekers, tinatawag sa Ingles, yung practice na paghahakot ng tao at dadalhin sa eye center para maoperahan. At nakita natin na yung mga kinukuha, ang karamihan, halos lahat. In fact, yung iba nga, tinatanong kung PhilHealth member. Kung hindi sila PhilHealth member, hindi sila hinahakot. Ngayon, mayroong mga nagsabi na they were just advertising and advertising is allowed. But there is a difference between solicitation and advertising, and we know that ayon sa Medical Act of 1959, one of the grounds for a reprimand, suspension, or revoking the certificate of registration of a physician is the violation of the provision of Code of Ethics of the Philippine Medical Association. And Section 4 of the Philippine Medical Association says, a physician shall not employ agents in the solicitation and recruitment of patients. Okay. Today we will continue the findings of the Internal Audit Group of PhilHealth. We would also like to look into the relationship between the Department of Health and PhilHealth. I notice Attorney Lutero is not around. Yes, because the power to revoke licenses to operate is lodged with the Department of Health. Is that, Attorney Padilla, would you know that that is correct?
Yes, opo. They're the ones issuing the licenses.
Yes. Therefore, I think it's very, very important and it's crucial that the Department of Health and the PhilHealth have the same voice. Ang labo naman kung sasabihin ni PhilHealth suspended, ang daming problema, tapos sasabihin ni DOH, hindi, okay lang yan. Hindi pwede yun. One voice, either for or against, whatever. The other thing I'd like to look into is as to the history of institutions with violations. And the so-called, sa English, sa tinatawag natin, attorney, for some lawyers parlance, recidivist. Paulit-ulit ng violations, pero bakit wala nangyayari? Ayoko mangyari ngayon na maghihiring tayo, tapos wala na naman mangyayari. Dapat naman may mga reforma mangyayari. Lalong-lalo na sa polisiya at sa batas. Nakakalungkot talaga na nagagamit yung PhilHealth ng mga ilang institusyon at ilang doktor para lang ginagamit bilang kasangkapan as alleged, and I will emphasize as alleged, bilang kasangkapan para lang makuha yung PhilHealth funds. Pera ng bayan yan, so dapat pangalagaan natin. I don't need to emphasize how important and how helpful PhilHealth is to the public. Okay. Dito sa mga one administrative matter, sa resource persons natin na nandito ngayon, yung pong hindi pa nakapag-oath, pakitayo lang, Director General, please administer the oath for those who have not yet taken their oath.
Kindly raise your right hand. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth in this proceeding? Thank you. You may take your seats.
Director General, yung dalaw po.
Pakitayo ho. Kayo ho ba ay nanunumpa na kayo ay magsasabi ng katotohanan, buong katotohanan at pawang katotohanan lamang sa hearing na ito? Maraming salamat. Pakayo po na lang po ulit.
Okay. I understand, Attorney Padilla, you wish to make a PowerPoint. Dr. Mingita, you wish to make a PowerPoint?
Yes, Your Honor.
Okay, please proceed.
This is just some, to put everything into perspective, about blindness, we'll start with that, plus yung stress or yung mga priorities ng Department of Health as far as PhilHealth is concerned, and what we're also doing. Hindi lang lahat ho bad news, may good news din ho, no? And all of this we're also presenting because we would also like new legislation to help us promote universal health care more. As you know, PhilHealth is an attached agency to the Department of Health. We should be one. No? We've heard so much quoted about the National Prevention of Blindness Program, which was an AO signed in 2013. Now, ano ba talaga itong AO na to? Yung very first policy statement says, the DOH as the lead agency for the promotion and protection of people's health shall ensure the provision of the highest quality of appropriate eye care through the development of national standards for ethical practice, facility development, and service provisions. I highlighted certain words because this is really the essence of the AO. The AO also wants to ensure that local and government hospitals provide specialized services, equipment, manpower, facilities using appropriate techniques and technology. The AO also of the DOH wishes to maximize utilization of services in Department of Health and local government hospitals. Next slide, please. So the keywords are highest quality, appropriate eye care, ethical, maximize utilization of government facilities. The 2013 AO mentioned a goal of 216 good outcome cataract surgeries by 2016, or roughly 72,000 a year. It was meant at the time, wala pa ho yung automatic senior citizen. Before, wala pa ho ito. It was meant to address blindness and at least visually disabled, no? It was not meant to justify doing unnecessary or substandard surgical and laser procedures. It was not meant to justify exploiting the poor in the guise of public service. It was also not meant to justify unethical practices such as recruitment or solicitation, kickbacks, and deception. These are what we are against. How many are truly blind in the Philippines? The truth is we don't really know. Because the last survey of blindness was done way back in 2002, and this is a gap, really a gap, no? This is what people are quoting, but it's already 2015. Wala pa tayong talagang information. But the trend has been a decrease in the prevalence. From 1987 to 1995, it went down by 35%. 1995 to 2002, it went down by 17%. What about 2014? What about 2015? If you follow this line, baka we've already reached the 0.5%, which is the Vision 2020 goal. By 2020, we should have brought down our blindness prevalence by 0.5%. In 2002, 0.58 na tayo. So, why has this not been really stressed? Parang we're also downplaying the role of the DOH and the eye doctors in bringing down blindness. We have brought it down, but we don't really know ano ba talaga ngayon. So, glad to say DOH has just agreed to fund another blindness survey. This is done by the Philippine Eye Research Institute of UP Manila. In the meantime, this AO is being addressed, examined again, and a new AO is being finalized to specifically address cataract blindness in the poor, because they are usually the ones exploited. Now, this is based on the UP Manila research, no? In the unlikely event that we have not decreased prevalence of blindness since 2002, and it's still 0.58%, the real blind is about 180,000 from cataracts. But this is the blind, 2,200 and worse. What the visually disabled will be more than this. Okay? Wait, can you go back? No. If we were to do another survey of blindness, we expect this to change. We expect an increase in retinopathies due to diabetes, because there's really an epidemic of diabetes, and there's a growing number of people with renal kidney failure because of diabetes, and those with kidney failure most likely also have problems in the eyes. We expect more macular degeneration from age. We may even expect more corneal opacities, because I showed you the other day we are having more and more corneal problems that need transplant because of complications of cataract surgery. Next. No? Where are the majority of the blind? This is again based on 2002 statistics. Well, and DOH is concentrating in Tacloban, Samar, Surigao, Sarangani, Masbate, ARMM. Fortunately, NCR, Southern Tagalog, Cordillera, Central Luzon, compared to these other regions, have relatively lower concentration of blindness because of the higher concentration of eye surgeons. Again, I am not speaking in certainties because this is 2002. Next slide, please. Next slide, please. That's what happens when you just depend on numbers. And we're not here to talk about numbers. We're here to talk also about proper use, quality, ethical, appropriate. But just food for thought. In 2015, projected population is over 102 million Filipinos. 6.8% are going to be over 60 years old. That's about 7 million people. All people over the age of 60 have some degree of lens change or cataracts. It comes with aging, but a small percentage only should require surgery. Not all of these people. Not the 7 million will all go out there, sige, hanapin natin yung 7 million, operahan natin ngayon. Kasi lahat yan may katarata. Hindi naman ho yun ang tama. No? So indiscriminate PHIC utilization just for cataract alone will strain the National Health Insurance Program, and it will not be able to address true medical needs of our people. For example, if each ophthalmologist would make hakot and try to do 194 cataracts a month, it'll be already 56 billion. If they have 2 eyes, you double this, dalawang mata. If we also do the indiscriminate use of lasers, that's another like another 56 billion kung 2 eyes. My point is, PHIC exists for all diseases, all illnesses. We are here for health security. So if you're doing indiscriminate procedures, that is not health security. That is wasting funds to do things which are not necessary, and you therefore sacrifice other diseases. We have cancer, as you know, heart disease, diabetes, you name it, the whole gamut. And funds are not naman unlimited. So doctors should be responsible. The current priorities of the Department of Health as far as PHIC is concerned are, we want to make PhilHealth even more relevant because it is already very relevant to the people, more felt and more responsive to the healthcare needs of Filipinos. We have already expanded the Z benefits to include more hospitals around the country. I think 17 new hospitals have already registered, and it's just a matter of signing contracts with them. Z benefits are the catastrophic cases, open heart surgery, breast cancer, etc. No? We are studying the case rates. Iba kailangan liitan, iba kailangan dagdagan, iba kailangan magdagdag tayo ng mga ibang procedures kasi nag-iiba naman ang medisina. It's not stagnant, it's dynamic. We want to expand benefits, mga outpatient check-ups already. Dialysis sessions are now 90 instead of 45. We're already doing this. We feel we have so little time till the end of this administration. We want to do these things as soon as we can. But another marching order of the present Secretary of Health to us was to reduce fraud and abuse and assure quality. Because if you reduce fraud and abuse, you will have more money, mas maraming pera, para talagang sugpuin ang mga sakit na kailangan sugpuin at gamutin. Upcasing, na pag-usapan na ho natin yan, ubot-sipon lang at ina-admit na bilang pneumonia na 32,000 each. We have identity theft, mga kumukuha ng identity ng ibang pasyente at ginagamit para sa kanila, sa PhilHealth. Ghost patients, meron din tayo. Fictitious admissions. Meron tayong balita ng isang doktora na naglalako ng mga admitting orders at kompletong history ng pasyente. At ano na ho yun, 3 admission na yon nilalako sa mga ospital na willing mag-participate sa ganitong panloloko ho at sa PhilHealth, no? Na wala namang admission, pinapalabas na maa-admit. These are the things we have to go after. And it is not victimless. Aside from the fund which is victimized, the people who are the ones contributing to the fund, pati yung mga pasyente na nagagamit. There are cases na gusto mo mag-apply ko yan ng trabaho. Tapos marireject ka, sasabihin, oy, may kidney disease ka pala, meron ka palang ganon. Pala, nagamit yung identity mo para magpa-admit na meron ka palang sakit. And these are victims as well. We have to ensure that PHIC uses its quasi-judicial powers to effectively uses its quasi-judicial powers effectively. We should bring back, this is one of the things that the Secretary of Health feels very strongly about, good standing in professional organizations as requirement, and perhaps amend the Medical Act of 1959. It's been too long. No? Nursing Act has been amended, Pharmacy Act, pero yung Medical Act hindi pa ho. No? It's one of the legislative requests we have. We have to upgrade the IT system of PhilHealth because without an adequate IT system, it's very difficult to monitor and to prevent fraud and even monitor the benefits to the patients. And we must align DOH and PhilHealth. As the good senator said earlier, hindi ho aligned in many ways. Yung licensing ko, minsan ho, there was an AO issued na basta bigyan ng lisensya ng DOH, dapat automatically accredited ng PhilHealth. Hindi ho pwede yon kasi yung licensing is just daw for safety. Pwede ka namang safe, pero puro unethical ang mga practices, puro pangloloko. Hindi naman pwedeng i-accredit ng PhilHealth. So ngayon ho, DOH and PhilHealth we are now working together para lahat ho ng gagawin namin as far as accreditation and licensing are actually aligned. Now, I would like to bring this problem to the attention of the Senate committee. Remember, we said that the Department of Health wants also to strengthen the local and national government hospitals. No, this is sadly a non-ideal model proliferating now, and I'm asking the question: Is this graft? No. For example, local government official uses LGU resources and employees to recruit patients in barangays to bring them to a private hospital or ambulatory surgical center, usually owned by relatives or by the LGU official or business partners. Patients recruited are almost always the sponsored patients enrolled using government funds. Patients are enticed, snacks, payments, etc., often misinformed. The LGU official and family or business partner that owns the healthcare institution earns hundreds of millions while depriving local government hospital of potential income and leaving it decrepit. When we tell them, dalhin naman ho ninyo sa government hospital, sasabihin, bakit naman dadalhin sa government hospital? Bulok naman ho ito. So how can it, see, when PhilHealth, the presence of PhilHealth, there should be no excuse for government hospitals to remain decrepit. Andun ho yung pera. Pero political will ho ng mga local government officials is to help their local hospitals. Hindi ho sa ganitong paraan. So it goes against the vision of the health program and the Department of Health. Fortunately, we also have a good model that actually is working. It's the Linaw Tingin model of the Tarlac Regional Hospital, and we would like to commend them for this. How does this work? The Tarlac Regional Hospital invested in equipment and invited private ophthalmologists to see patients and do surgery. Meron silang 10 volunteer doctors na nagro-rotate ho sa ospital. They see the patients in a check-up ng libre at gumagawa ng operasyon. Sa kanila ho, yung professional fee, no balance billing, PhilHealth only, yung fee ng hospital na pupunta sa ospital. The hospital gets their share, the funds are used to maintain and improve hospital and shared among hospital staff. There's no sweeping, meron silang magandang pre-operative check-up, meron silang magandang follow-up, at tama ho ang paggagamot. Ang sabi ho namin, dapat may shuttle kayo kasi ang usual problema access. So, may pick-up points yan. Para pasyente, kung kailangan ko magpatingin sa doktor, hindi lang ho sa mata, alam ko na at certain point, at certain days, merong hong shuttle na iikot at makakapunta ako sa ospital. This is the kind of attitude we want for the patients. We want to empower them. Ito ang tamang attitude. Hindi yung maghihintay kayo ng hahakutin kayo, maghihintay kayo ng medical mission. Wala na ho dapat ganon. May PhilHealth na ho. So, everybody who are happy, no? And they can maintain, the hospital can maintain good standards of care kasi may PhilHealth ho sila. Ito ang gustong mangyari ng PhilHealth. Ito ang gustong mangyari ng Department of Health. Next slide, please. So, almost finished, no? Right now, a new AO is being finalized with a technical working group of experts to be called soon. It's called Ensuring Access to the Poor to Operative Cataract Services in Government Hospitals using the National Health Insurance Program. Aside from this, we are also closely working with the ULAP, with the Union of Local Authorities in the Philippines to replicate the Tarlac model. They have promised us at least 5 new provinces in a month to at least start working on this. It will help ensure accessibility to competent, ethical doctors, appropriate and safe care with adequate pre-op and post-op. This is definitely a gap that we need to fill if we are to really help our patients. My final slide is this. I adopted this from a cartoon in The Economist, the May issue, which tackled 10% of the U.S. healthcare money goes to fraud, which is about $228 billion. Pinalitan ko lang, invest na Medicare, PhilHealth, invest na cap ni Uncle Sam sa lakot. Pero it's the same thing. PhilHealth is a treasure, malaking kayamanan. Those doctors who have known what it was like to practice without PhilHealth and practice with PhilHealth today, ang laking-laking tulong ho ng PhilHealth. Malaking ginhawa ho. So we have to use it responsibly and ethically. This is my appeal as a doctor to my colleagues. This is the appeal of the Department of Health. We have to also preserve the dignity and nobility of the medical profession. Let us not wait for the day na ang pasyente ho ay hindi na makakasiguro na ang kapakanan niya ang iniisip ng doktor, kung hindi ang pera na lang ho. Ang tingin natin sa pasyente dapat ay taong matutulungan, hindi tao na magkakakitaan. Yun ho ang difference ng ethical at unethical. At kung ang mangingibabaw ho ay yung mga tao, yung mga recruiters, mga sindikato, na pati ang pag-practice ho ng medisina ay kinokontrol na ho nila, hindi na ho mangyayari yung ethical medicine, hindi na ho makakasiguro ang pasyente na talagang kapanganan niya ang isip ng doktor. So let's reclaim it and save it from being sullied and destroyed because of greed. I'm not saying only because of greed of a few doctors, but pati ho yung mga nagsasamantala. Kasi ho sa US, sindikato na ho ang mga involved. Dun sa mga 246 na in-indict nitong biggest fraud catch, over 100 were doctors. The rest were syndicates and other businessmen. So, wag na ho nating hintayin na umabot sa ganyan. No? Let's try to solve it today. Thank you very much. No?
Thank you, Dr. Padilla. Tama po yun. Huwag natin antayin na magkaroon ng mafia o sindikato dito sa fraud, sa PhilHealth fraud, no? At this point, let's have a recap. Attorney Padilla, sir, could you summarize, no? We have how many eye institutes here? 1, 2, 3 eye institutes, and there are common findings of the internal audit. There are various violations as found in the audit report. Could we have a summary so that we can have a recap of the main points, common points? Dr. So will be the one to talk. Okay, Dr. So, yes.
Thank you, Your Honors and guests. No? Basically po, the corporation actually found common findings in all the audited eye centers po and facilities. No? The breaches were, all of these were breaches of the performance commitment, particularly, number 1, breach on the provisions on solicitation of patients, which is not allowed. Number 2, breaches on the provisions on quality care, the provision of quality care. So there were patients in all of these eye centers where we found out that, for example, follow-up was not done within the allowable period of time, or acceptable period of time, that eventually led to certain blindness for some patients po in some of these eye centers. Thirdly, there were violations on patients' rights. Some of these patients did not know the procedures that they were supposed to undergo. They didn't know what was being done, or at least if they knew, it wasn't exactly as it was supposed to be explained. And also there were patients that didn't know what type of intraocular lens was placed inside their eye. And fourthly, there were violations on the provision on having written guidelines on credentialing and privileging of their doctors po. So all of these facilities should have written guidelines that they should follow to make sure that only properly credentialed doctors are given the privileges to actually perform certain procedures. And apparently, there were no written guidelines. So these were the common findings in all of these eye centers po. There are also unique findings po in certain eye centers, and the unique ones included actual cases of misrepresentation and fraud po.
Okay, thank you very much. Maybe at this point, let's call on some patients so that we can have actual testimonies, no? We would like to call si Romeo Fernando. Mang Romy, paki-assist lang. Okay. Magandang umaga po, Mang Romy.
Magandang umaga po sa inyo at sa lahat ng nandito.
Oo. Pakilapit yung mic sa kanya. Mang Romy, pwede nyo ba ikwento kung ano nangyari sa iyo? Salaysay nyo po.
Ako po ay lumalabo ang aking paningin. Ay ako yung nagpunta doon sa aming City Hall sa Pasay at nasabi nga sa akin na pumunta ka ng Boros sa MUA. Pagpunta ko ron, kailangan daw mayroon kang ID na PhilHealth Lifetime ID. So, ginawa ko po, nakakuha ko ng lifetime PhilHealth.
Sinabi po
ID.
sa inyo, kailangan may PhilHealth ka.
Doon na sa Boros.
Sinabi po, kailangan may PhilHealth ka.
Kailangan may PhilHealth card ka.
Okay.
Kailangan lifetime. Kasi senior ka na eh. Ngayon, di makakuha ako. Nagbalik ako. Ang sabi sa akin, sige, nung mga tignan ako, sige, i-schedule ka na. Schedule ka na, Merkules yata yun. Mga ganun, mga Wednesday, January 2012. Nung ako'y maoperahan, ang unang tumingin sa akin, ang umopera sa akin, ay si Dr. Olalia.
Dr. Olalia.
Opo.
Okay.
Aba, nasiyahan naman ako dahil napakaganda ng operasyon.
Saan po ito? Sa Boros?
Sa Boros po, sa
Mall
MOA.
of Asia?
Sa Mall of Asia.
Okay.
Nasiyahan naman po ako at magmanda, malinis. Ngayon, ang tanong sa akin, meron ka bang pera, babayaran mo itong lente ng 6,000? Eh sabi ko, ako walang pera, kaya nga ako sa PhilHealth lang ang ginagamit ko. Ay, kung wala kang cash, lalagyan na lang natin ng ordinary yan. Mata mo. Eh sabi ko, yun na nga, i-charge nyo na lang sa PhilHealth. So after that, wala na. Tapos na-operahan ako. Pinabalik ako after 1 week. Natanggalan daw ako ng tahi sa aking lente. So, sabi sa akin, nung pagkatapos matanggalan tahi, bumalik ka rito after 3 months. Dahil na required ng PhilHealth, after 3 months, pwede namang operahin yung iyong kanan.
Sandali po. Yung sinabi po sa inyo na yung lente kailangan 6,000, pero
Opo.
sabi mo wala kang pera.
Opo.
Okay, Attorney Padilla. Oo, hindi ba pasok na yan sa case rates dapat?
Opo, yung 16.
Hindi dapat hingan yung pasyente ng extra?
Well, yung 16,000 ho na binabayad namin bawat mata includes the services, professional fee, as well as yung lente. Kasama na ho yan.
So kasama na yun po sa lente. Attorney, Dr. Padilla.
Kasama sa lente if it's NBB. Di ba ho? Kasi, depende ho kasi kung no balance billing, yung lente ho na kasama doon, admittedly, is really the least expensive lens. No? Pero kung some patients would prefer a more expensive lens, out of pocket na ho yun. So, if it was offered ho before the surgery, okay naman ho yun. Kasi hindi naman after. In other words, depende ho. So, kung NBB ang pasyente, yung lente ho kasama dun sa package, no? Tapos yung lens, kung minsan ho, some patients prefer another lens, a more
Okay.
expensive one. Then
So,
that's not anymore kasama
yes,
sa
yes,
package.
yes.
Oho.
Pero anong nangyari sa iyo, Mang Romy, basta lang inalok sa iyo yung lente, hindi
Opo,
ka pinapili.
Hindi, nung sinabi po sa akin 6,000, ang sabi ko, wala akong pera, kaya nga PhilHealth lang ginamit ko. Meron kami dito, 1,500. Sama nyo na lang sa PhilHealth yan, sa aking may wala akong pera. So, di natapos nga ho. Okay na.
Bukod doon, wala bang sinabing tungkol mga karapatan nyo bilang pasyente?
Hindi ho, yun lang ang sinabi sa akin, yung
Yung
mga
lente
bawal.
lang.
Yung mga bawal na gawin ko.
Bawal na
Bawal yung magpahangin ng mata, bawal yung mapainitan ng mata, bawal yung
matapos nyo pong maopera, sabi bumalik ka in
3 months, after
3
3 months. Dahil ng regulasyon ng PhilHealth para operahin yung kanan. Sabi ko, akala ko kaliwa lang. Hindi, pati yung kanan, kailangan kailangan operahin. So, nagbalik ako after 3 months, mga April. Kasi January yung una eh. So, April, pagdating ko doon, di sabi sa akin, may schedule na kayo sa sabi nung secretary doon sa Boros. Sabi niya, Lynette yata yun, Lynette, kung matatandaan. Sabi niya, schedule na ikaw ulit sa ganung petsa. Ganyan. Di bumalik ko ako. Pagbalik ko sa ganung petsa, di sinalang na ako. Sinalang na ako doon sa operating room. At nga, ang sabi ko, natanong ko, bakit iba ang doktor? Hindi si Dr. Olalia, wala, nasa bakasyon. So, ang nag-opera sa akin, tinanong ko, ay Dr. Cabrera sa kanang mata ko. Nung ino-opera na ako, nasasaktan ako, sabi ko, teka Doc, masakit ka ako. Hindi naman ganyan si Dr. Olalia umopera. Sabi ko, tama na, at saka ang tagal-tagal na eh. Kasi si Dr. Olalia, 15 minutes, tapos na, maginhawa ang pakiramdam ko. Nung si Dr. Cabrera umopera sa akin, hirap na hirap ako, kalahating oras na ako mahigit. Eh sabi ko, hindi ko na kaya, pakihinto mo na lang. Sabi niya, hindi, tapos na yan, tapos na. So, okay. Kaya ako nilagyan niyo ba ng lente ang mata ko? Sabi niya, meron na. Okay lang ako babalik. O kahit hindi ka na bumalik, check upin na lang kung gusto mo bumalik ka dito. Di, tapos na ho. Ayun, tumagal. Lumalabo hanggang sa dumilim ng dumilim. So, ang ginawa ko, nagpa-second opinion ako. Yan sa Pasay General na sa Opta. Sabi lang sa akin, kasi katandaan na yan eh. Sabi niya. Sabi ko, hindi naman kako ganyan dati eh. Tapos nung may babalitaan nga ako na taga Cavite, na dati kong kaibigan, sabi niya, may depresya mata mo ah. Pumunta ka doon sa hanapin mo yung Pacific Eyes sa likod ng Makati Med. Sabi niya, pumunta ka ron, tanong mo na lang doon sa building ng ng Medical Plaza. So, nangarating ako doon. Pagdating ko doon, pumila ng matagal, dahil sa dami nga ng tao sa baba, bago kami nakaakyat. Pagdating ko doon, tinawag ako ng nurse doon sa loob. Ang tumingin sa akin si Dr. Cabrera. Ang sabi niya, sino nag-opera sa'yo? Ako, si Dr. Olalia. Yung pangalawa, si Dr. Cabrera. Ang sagot niya, ako yun. Sabi ko, pambihira kayo. Sira yung mata ko. Tapos tumawalan siya. Tapos wala na. Nung bumalik ako uli, na-schedule ako, ang humarap na sa akin, si Doktora Yu, babae. Tapos sabi ng doktora, kailangan ma-laser na. Ma-laser ka, yan lang ang gamot niyan sa kaliwang mata mo. Wala na tayong magagawa doon sa kanan mo. Wala naman sinabi, basta wala na tayong magagawa doon sa kanan. Yung kaliwa mo, pwede pa natin buhayin yan. Through laser. Mga dalawa lang yan, okay na. Inabot na nga ng 3-4. Nung pang-apat na, sabi niya, magdadagdag ka ng 3,500 sa injection para wag lumabo ang mata mo. Sabi ko, wala naman akong hanap buhay, parang hihingan mo pa ako ng 3,500. Sabi ko gano'n, hindi na ako bumalik. Ay, doon na nga, nung hindi na ako bumalik, unti-unti namang lumalabo itong kaliwang mata ko.
Saan po itong hindi na kayo bumalik? Saan pong lugar to?
Sa Pacific Eyes po.
Okay, sige.
Kasi wala nang pag-asa ro yung kanan kong mata eh. Sabi ng Doktora Yu. Tapos, sabi ko, sige, schedule na lang nyo ako ng laser. Sige, magkumuha ka ng MDR. Ito, kailangan ng ID mo, tsaka MDR. Tapos yung PhilHealth, senior citizen. Ayun, di nagamot nga ako, na laser nga ako hanggang 4 na beses na. Sa pang-4 na beses, sabi niya sa akin, kailangan magbayad ka ng 3,500 para hindi lumabo ang mata mo. Sabi ko, wala nga akong pera eh. Kaya hindi na ako bumalik sa Pacific Eyes. Yun ang huli. Wala na.
Tapos, ano pa nangyari doon? Tapos, ano nangyari sa iyo after that, pagkatapos noon?
Yung pagkatapos nun sa Pacific Eyes?
Sa PGH? May
ito. Nundo nga po ako ng PhilHealth at dinala ko sa PGH. Doon sa UP PGH. Nung tinignan ako ng 4 na doktor, sabi nila sa akin, iisa ang findings nila. Nabutas ang iyong iris sa operasyon mo. Wala ba sinabi sa iyo yung doktor mo? Kako, wala. Wala sinabing na galusan o na ang iris mo ka. Wala. Sabi niya, may butas ang iris mo na hindi na natin pwedeng magamot.
Okay.
Yun lang po.
May tanong lang ako, Attorney Padilla. Sinabi po ni Mr. Fernando yung pagkatapos ng operasyon niya sa Boroughs, sabi daw, kailangan bumalik siya after 3 months. dahil daw yan ang regulation ng PhilHealth. Totoo po ba yun?
Dati ho, meron kaming 90 days na pagitan bago magkaroon ng similar or second operation. Pero ngayon ho, tinanggal na ho yan as early as August 2013 na ginawa ng isang araw na lamang. Pwede.
Isang araw na lang.
Oho, pwede.
Pero dati meron.
Meron talaga 90 days na.
Okay. At ang tanong ko, siguro sa Philippine Academy of Ophthalmologists, no? Yung post-op, pagkatapos ng operasyon, 3 months ba talaga dapat pabalikin? Ano ba dapat?
The first post-op po, initial post-op should be between 24 to 48 hours after the surgery, Your Honor.
24 to 48, not 3 months. Not 3 months. Okay. Mang Romy, pumunta ko daw kayo sa Boros at sa Pacific Eye Center.
Opo.
Okay. Nakalagay dito sa affidavit mo, sa sinumpang salaysay mo, na napaka-dami ng pasyente na nandun sa mga...
Pareho po. Boros at saka sa Pacific Eyes, napakarami ho.
Ano mang napansin nyo?
Ang napansin ko lang doon sa Boros, mayroong isang matabang babae na nagdadala ng mga tao, ng pasyente. At sa Pacific Eyes, nakita ko naman may mga naka-uniforme ng blue na nagdadala rin. Ewan ko kung kakilala na rin o saan sila galing. Ilang napon ako. Kaya ang dami ng tao.
At anong oras kayo dumating doon?
Ay pumipila ho kami sa baba. Magmula alas 6, alas 7 ng maga. Matatapos kami ng mga alas 4 ng hapon.
Alas 6 ng umaga, ang pila, alas 4 ng hapon ang tapos.
Nakakauwi, oo. Pagdating ko doon, may mga nakapila na una.
Okay. Ganun karami.
Ganun karami po.
Ganun karami. Okay. Tanong naman natin kay...
I have a...
Sandali po. 1 minute suspension. Sige. Hearing resumed. Mr. Bonifacio Martinez. Magandang umaga po.
Umaga po sa kanila lahat.
Okay. Ano pong palayaw nyo?
Boy po.
Boy, Manong Boy. Pakikwento naman kung ano nangyari sa inyo po.
Nung hindi pa po ako nabubulag, talagang nagsadya po ako sa Hospital ng Maynila at sinabi sa akin ng opta na talagang hinog na daw ang katarata ko. Kaya hindi ko naman po nagawang patanggal gawa ng kakapusan ng pera. Nag-second opinion po ako sa Philippine General Hospital. Ganun din po ang sinabi sa akin. Nung napadaan po ako sa aming barangay, nakita ko po may libreng tanggal katarata ng isang foundation ng isang politiko. Agad po kami pumunta na aking may bahay at itinuro sa akin kung paano kami pumunta sa MOA. Doon po sa MOA, doon po yung Boro Medical Clinic. At doon ko po nakitang maraming taong nakapila, na karamihan po ay matatanda, na may kapansanan din sa katulad ng katarata. At doon ko din po nakakilala yung sekretary si Ninette, na hinanapan kami ng, tinanong ako kung ako daw ay member ng PhilHealth. Ang sabi ko, wala akong member, pero yung aking may bahay, meron. Nung in-schedule po kami ng bawat grupo, in-schedule kami, kaya April 3, 2013, na nakasalang na po ako sa operasyon. Nasaktan po ako nung pagdaan ng laser hanggang pagkabit niya ng lente sa akin. Nagalit pa nga sa akin si Dr. Ruby Reyes na nagtanggal sa amin sa katarata. Nagalit pa nga sa akin kung bakit daw ako gumalaw nung oras na inooperahan ako. Sabi ko, Dok, nasaktan ako masakit. Paglipas ng mga 3 araw, napansin ko sa mata ko, meron ako nakitang parang tuldok ng maitim na tuldok ng kasilak ng pentel pen. At unti-unti itong na-block sa paningin ko hanggang wala akong makita. Bumalik ako sa kanya.
Kanino po? Kanino po kayo bumalik?
Kay Dr. Ruby Reyes sa Borot.
Sa Borot. Sige, tuloy po.
Niresetahan niya naman ako ng 2 klaseng pampatak. Pero kinabukasan, lalo lang itong namaga. At muli akong bumalik sa kanya. Ilang beses din akong bumalik sa kanya. Pinalitan niya lang ng pampatak. Hanggang, subalit, lalo lang namaga ang mata ko. Hanggang sinabi niya sa akin, pumunta ka na lang doon na lang tayo magkita sa UST para makita ng espesyalista sa mata. Kinabukasan, pumunta po ako sa UST at doon kami nagpangita. Pinakilala niya sa akin si Dr. De Rosario, yung doktor na resident ng Opta, na siya daw muna ang titingin sa akin. Napagalaman nila na ang mata ko pala may fungal infection na. Ilang linggo rin akong pabalik-balik. At ng April 27, hindi na nila ako pinauwi dahil kailangan daw akong maoperahan na. Dahil yung fungal infection daw, pumasok na sa loob ng mata ko. At nung ako po naoperahan na, pinakuha nila akong ng cornea na transplant daw sa mata ko na subalit hindi ito natuloy gawa ng yung fungal infection daw pumasok na sa loob ng mata ko. At matutuluyan na daw akong mabubulang. Nung paglipas ng 4 na araw na nailabas na ako ng operating room, lumapit po sa akin si Dr. Ruby Reyes na may pinapirma sa akin na 6 na pirasong papel na sabi niya katibayan daw na hindi nila ako pinabayaan.
Pinabasa ba sa iyo yung papel?
Hindi ko na po nabasa gawa ng yung hilo pa ako.
So habang hilo ka, pinapirma sa iyo yung papel?
Pinapirma po ako ng at inabutan niya ako ng sobre na may laman 10,000. Mula noon, hindi na kami, wala na pong...
Inofferan ka ng sobre na may 10,000 piso. Para saan daw yung 10,000 piso?
Tulong niya daw yun. Kaso, nung napirmahan ko na, hindi na po sa amin nagpakita.
Hindi na nagpakita sa iyo?
Hindi na po. At kinokontak namin sa cellphone niya, hindi na pa rin po sumasagot.
Hindi na rin sumasagot. Sa mga tuwid, binigyan ka ng pera at habang hilo ka, pinapirma ka, tapos na-snub ka na. Ganun
wala na
yun.
po.
Bukod doon, saan po, after that, pumunta kayo sa ibang ospital? Hindi na.
Nung bandang huli po, na alam kong wala na, parang hindi na ako kaya pagalingin sa UST, na lumipat po ako ng ibang ospital at doon nagkaroon naman ng pagbabago.
Pero natuluyan na bulag ka na?
Natuluyan na po.
Nabulag na?
Bulag na po.
Opo. Okay. Dr. So, may tanong po ako. Kailan po ito si Mr. Romeo Fernando at Bonifacio Martinez, kailan po na-opera sila? At saan? Well, sinabi na nila kung saan. Pero kailan po na-opera sila?
Based on our claims data po, sir, no? Si Mr. Romeo Fernando po, April 19, 2012 po ang right eye niya for cataract. No? Yung left rin po niya, I think, no, was also the same, 2012 rin po. No? Tapos kay Edilberto Garcia po,
Hindi.
ay, sorry.
Fernando.
Bonifacio Martinez, no? April 2013 po.
So yung dalawa, April
Yung isa po 2012.
2012.
April, tas isa po April 2013.
2013.
Ano po, sir, if I may just
Sige.
explain yung halimbawa po, yung kay based on our claims data po, kay Romeo Fernando, yun po, nagpa-opera po siya ng 2012 for cataract, no? Left eye, no, and right eye. Eventually po, yung right eye po niya, pwede naman pong i-confirm, dito po yung pasyente, no, nabulag po. Okay? Tapos, nung nabulag po yon, nung 2014 po, no, 2014, meron po tayong magkakasunod po, no, this is from February 27, March 25, April 8, and April 22, yung left eye po niya may 4 na laser claims po. 2 of them are, we would like to believe na laser treatment for the diabetic retinopathy, pero 2 of them po on the left eye were what's being called YAG laser capsulotomy. So yun po yung ginagawa as a complication of cataract. No? So this was done 2 years after, pero what is notable po sa audit namin was that yung ginawa po sa left eye na YAG laser capsulotomy was done almost just 8 days apart. Tapos sa right eye po,
8
sir,
days apart yung laser.
yung YAG laser
Yung YAG
capsulotomy
laser.
claim po nila. All of these claims were paid po by PhilHealth.
Yeah. Teka muna.
Yes, sir.
8 days apart. Sinong 8 days apart?
Yung, kasi po, 4 na laser treatments po ang
Same person.
pinagdaanan ng person. Opo,
Okay.
si Romeo po ito. Opo.
Si Romeo.
So, nung
Okay.
Feb 27 po at nung March 25 po, sa database po namin, nag-claim po ng YAG laser on the left eye. So, the 2 procedures were just 8 days apart po. And sa left eye. Sa right eye po, yung nabulag na po na mata, no, kung tama po ako, no, March 6, 2014 naman po, 1 month apart po pala yun. Pero yung March 6, 2014 po pala, on the right eye, nabulag na po. March 6, 2014, may claim po sila under Dr. Cabrera ng YAG laser capsulotomy on the blind eye.
Yes, pero anong significance nito? So
Okay.
you're just telling us there's a time lag
Correct.
between the two. What's the
Well,
significance?
sorry po, no. Yung left eye po pala almost 1 month apart, pero we believe kasi it's unnecessary procedure po sa tingin namin, and we hope that the experts can validate, no. Una po, pagbulag na po yung mata, ni YAG laser pa po, mukhang hindi na po kailangan gawin yon. At nag-claim pa po sa amin itong doctor through the eye center po. Yung sa left eye po, yun nga, meron na po siyang mga signs of diabetic retinopathy, pero may 2 pong complications of cataract na laser pong ginawa na kinlaim almost 1 month apart lang po. The way we were briefed on the complications of cataract, usually they develop nga po 6 months to 5 years, no? And when you do the YAG laser capsulotomy, kadalasan dapat malinis na. Hindi na po kinakailangan. Pag may mga very rare cases na may natitira po, no, tsaka lang uulitin. Sa amin po kasi, yung sa left eye na 2 po 1 month apart, raises a red flag. Yung sa right na bulag na po na ginawan seems like hindi na po talaga kailangan.
Can we ask the Philippine Academy of Ophthalmologists to respond to that? Yung sinasabi po ni Dr. So?
Your Honor, for the procedure YAG capsulotomy, this is usually done po after cataract surgery if the posterior capsule of the lens becomes opacified. This is something that's not very common, and we perform the procedure usually about maybe a year after the surgery.
A year?
Yes, or more.
Or more, because ang claim nga may procedure na hindi kailangan gawin.
Yes, Your Honor.
Dr. Padilla, anyway, you're also an ophthalmologist. Please.
Yes, statistics-wise ho, the probability na magkakaroon ng pangangailangan for a YAG capsulotomy within the first year after a good cataract surgery is between 2% to 11%. Yung 20% after 5 years na ho yun. And if done too soon, it's also dangerous for the patient. If it's less than a month or 2 months after the surgery, kasi kung minsan hindi pa ho stable yung lente, magle-laser na kayo, you can have problems. Kaya ho, ito, isa sa mga red flags na nakikita ho namin, ang ginagawa ho ng maraming questionable centers is, inooperahan sila, hindi nila fina-follow up when they should, which is between 24 to 48 hours, pinapabalik after a month or 2 weeks or a month, tapos para lang i-laser, para kumita uli. It's very, very unlikely na mayroon ng indication for the laser at that point in time. So because of these findings, gumawa na ho ng bagong patakaran ng PhilHealth recently na hindi ho namin babayaran ng ganung klaseng laser if done less than 6 months after the cataract surgery. Because isa sa mga abused procedures na ho ito. And pattern ho nakikita at sinasabi sa amin ng mga pasyente na nile-laser nga kahit kung minsan pagkatapos pa lang ng operation, sinasabi na sa kanila, bumalik kaya para i-laser kita. You cannot
Bakit po kailangan, kailangan yan mga 1 year after kung
No,
sakasakali?
Kung sakasakali, no, it's very rare that it appears. Okay?
Okay.
But it's even more questionable if after your surgery, sinasabi mo na sa pasyente, bumalik ka para i-laser kita. Parang pinipredict mo na magkakakomplikasyon siya, which is a long-term complication. Then you have them come back 2 weeks after or 1 month after. In other words, it's already a scam. This is definitely a scam. If the doctor tells the patient that, right after surgery, bumalik ka para i-laser kita. It's you understand, Your Honor? That's what I'm saying, no? It's something you don't predict. It's something you don't want to happen because it is a complication of cataract surgery. So you don't tell the patient to come back just to be lasered.
Okay. I'd just like to acknowledge the presence of Mr. Rudolph Tan and Regina Obligacion of the Food and Drug Administration. And of course, Attorney Lutero of the Department of Health and Attorney Christine Maranay de Guzman of the FDA. Yes.
Clarification. Sorry, Your Honor.
Go ahead.
May I speak? No, I was talking in generalities about why the red flags raised by many eye centers. But this particular case, Dr. So was saying, it was 2 years naman after the surgery na nag-YAG laser. That's okay, no? It happens. Pero yung questionable ho dito, yung two YAG lasers, less than a month apart in one eye, tapos yung matang bulag, na wala na pag-asa makakita, ni-laser pa. Yun ang tinatanong rin.
Matang bulag na, ni-laser pa.
Yun ang red flag ho yun.
Kay Mr. Fernando yun?
Yes.
Dr. So?
Yun ang...
Can you speak
Yes.
into the mic?
Yes, Your Honor. Kay Mr. Fernando po yan.
What about naman itong fungal infection ni Mr. Boy Martinez, Dr. So? May findings kayo doon?
Opo, sir. Ang findings po namin po kasi dito should be taken in a bigger sense. No? Kasi po, what happened was when we were doing our domiciliary, we actually discovered na 3 pasyente po pala at kasama nga po si Mr. Bonifacio doon, ang actually nagkaroon ng ganun pong komplikasyon. No? On the same day, the same facility, by the same doctor po. So, 3 po silang nagka-fungal infection.
Teka.
Apa.
Same day, same
Same
facility, same doctor, lahat na opera sa mata, lahat nagkaroon ng fungal infection.
At lahat po nabulag at lahat po tinanggalan ng mata. Opo.
Lahat na bulag, lahat tinanggalan ng mata.
Yun po yung observation po namin.
At lahat binayaran ng PhilHealth.
Lahat po binayaran ng PhilHealth. Opo.
Okay. But before we go to, yes, I see hands. Before we go to, I would like to ask Attorney Lutero, mga institusyon tulad ng mga eye centers, no? Like this what happened. Same day, same doctor, lahat na infect, lahat nabulag, lahat tinanggal na mata. Tanong ko is, how much, kasi kayo ang may karapatan magtanggal, magtigil ng lisensya ng isang institusyon na magpatuloy bilang health institution. Ganong ka tindi o ganong ka lax ang inyong pagpupulis sa mga eye centers at mga ibang institusyon na rin?
Yes, sir. Good morning. The function of the Department of Health, particularly the Bureau of Health Facilities and Services, is to license health facilities like the eye centers based on basically 3 items. One, physical plant or the facility itself, the medical personnel, and the equipment.
Like this, for example, may infection. So obviously, it has something to do maybe with the equipment. Do you check the equipment regularly?
At the time of when we issue the license, the equipment are up to our standards. But then, Your Honor, this is what I think is a weakness in the system, and which I think we should align also with PhilHealth. That's what they were saying earlier. Is that after the license is issued, monitoring is a problem. And if, for example, if
now we're getting to, sige lang, no, we're here to plug the loopholes, to fix the system. So, once you issue the license, and I will quote you, monitoring is a problem.
Yes, because of certain lack of personnel, etc. But again, if we receive reports like this coming from PhilHealth, then we will take action, Your Honor, and we will review the license that we gave to the particular eye center.
Oh, pero unang sinabi mo, due to lack of personnel, etc.
Yes, Your Honor.
Pero napakahalaga nitong pagpupulis ninyo ng mga health facilities, no? Sa susunod po, could you submit to me a list of your ideas kung anong dapat nating gawin? Lahat na, pati budget, personnel, kung ano man kailangan para ma-plug itong loophole na ito.
Yes, Your Honor. We'll do that.
Ngayon, sinasabi mo, pagka naka-receive kayo ng report sa PhilHealth, gumagalaw din kayo.
Yes, if we, not only from PhilHealth, Your Honor, but complaints even from the patients, Your Honor.
Okay. Okay. Attorney Padilla, would you like to add to the discussion?
Well, ganun din po. Talaga naman, I think we are coordinating with DOH. At sa amin ho, in accreditation is purely on the reimbursements. Pero again, ang problem namin, just like yung DOH, nakakabayad na ho kami bago namin nakikita yung problema. No? So yun po. But at least, pag dumadating ho yung mga statistics, yung mga data, pinag-aaralan, nagkakaroon naman ho kami ng kaukulan hakbang to correct it kung nakikita ho yung mga statistics.
Okay, but there's one thing dito, hindi kaya yung infection dahil sa volume ng mga pasyente. Sinabi nga ni Romy at saka ni Mang Boy na si Romy, sabi niya 6 a.m., 7 a.m. nandun na siya, 3 o'clock p.m., 4 o'clock p.m. na siya na na opera. So, can you imagine ganong kadaming tao yun nag-aantay? And it seems to be, if you're like that, obviously, parang assembly line kayo, no? And so, there is a possibility that there will be infection because of the instruments, no? Dr. Cosingfield, sige.
Your Honor, may I lang, we might get lost for the trees, but your particular question po, yung sinasabi po ni Mr. Fernando, yan yung pila ng outpatient, yung konsulta po yan, hindi ho yan yung opera. Can you correct me po, Mr. Fernando? Yun po yung nagpapatingin na marami talaga.
Sandali po, ano bang tanong nyo?
Your Honor, ang sinasabi po nyo, marami po yung inoperahan, kaya baka maging risk na siya for infection.
Okay.
Opo. Ang sinasabi ko po, yung sinasabi po ni Mr. Fernando na marami.
Hindi lahat nagpapa-opera, nagpapatingin lahat.
Marami ho yung nagpapatingin talaga.
Lang.
Opo.
Posible. Yes, we will call you soon. Mang Romy will not be in a position to answer that, no? Because all he saw was may linya at nag-aantay siya. Ang alam lang niya, alas 7 siya nag-umpisa at inopera siya alas 3. Based on experience, posible nga naman. Hindi lahat, no? Nagpapatingin. Sandali. Let's ask the Philippine Philippine Academy of Ophthalmologists. I understand you have a statement. Dapat kanina pa kayo nag-ano. Can you respond and can you read your statement?
Good morning, Your Honor. This is a statement coming from the Executive Council of the Philippine Academy of Ophthalmology. The Philippine Academy of Ophthalmology, or PAO, is recognized by the Philippine Medical Association as the National Society of Eye Specialists and comprises 1,500 eye specialists practicing throughout the country. We are one of the major stakeholders in the reduction and prevention of remediable blindness nationwide. Our mission is to ensure patient access to quality eye care and to uphold the medical, scientific, academic, technical, and ethical standards of ophthalmology as a profession. Eye surgeries are complex, specialized procedures requiring much training and experience to obtain these skills. To become a member of the PAO, a licensed medical doctor has to complete at least 3 years of ophthalmology training in an accredited institution. The PAO member also agrees to continuously update his skills by attending continuing education activities and to abide by our Code of Ethics and Professional Conduct. The abuse of PhilHealth payments for eye surgeries, especially cataract surgery, has been an evolving problem for the past decade, and finding solutions to the situation has now become a major challenge for all stakeholders. A workable system is clearly needed to promote accessibility, but at the same time, ensure appropriateness and quality of care that are consistent with the tenets of universal ethics and professionalism. Without concerted action, PhilHealth funds may soon be depleted and needy patients deprived of care. The exploitation of patients and misuse of PhilHealth benefits is within the easy reach of unscrupulous participants who have developed industrial-scale processes that are now entrenched and difficult to discover, much less remove. In sweeping or soliciting schemes, hakot in the vernacular, paid recruiters are tasked to locate PhilHealth members and invite them for free eye examinations where patients are informed that they have an eye disease that requires urgent treatment and that treatment will be provided for free. Oftentimes, the patient is used to milk PhilHealth for as much as reimbursements as possible without regard to real indication for treatment. The patient is returned to their barangay without an inkling of what was done to them, of who performed the treatment, with little or no advice at all on how to obtain further care in case of complications. A minority of our colleagues has succumbed to these schemes of insurance fraud and cataract sweeping and has led unsuspecting patients into undergoing unnecessary surgeries. Unconfirmed verbal reports suggest that some of these centers employ substandard materials and procedures that contributed to disastrous and blinding complications. Unconfirmed verbal reports also suggest that some barangay officials, Office of the Senior Citizen Affairs officers, local health workers, politicians, non-government organizations, and even religious offices have been used without their knowledge in making a business out of PhilHealth benefits in the guise of altruism for the poor. We also recognize that PhilHealth fund abuse also extends to other medical specialties outside of ophthalmology. We respectfully ask for the Senate's help in investigating these reports. Some measures can be easily implemented that may promote quality eye care. First, under the current case rate system, any accredited provider, regardless of specialty and extent of training, may be reimbursed for performing even the most complex eye surgery. It is our humble recommendation that the current implementing rules and regulations be amended to reinstate the proviso that PhilHealth accreditation be granted only to those who are members in good standing in a professional specialty organization such as the PAO. This will assure that specialty procedures are performed only by competent and ethical practitioners. Second, it is also our humble recommendation that government agencies adopt PAO guidelines for standards of care. These guidelines are based on best medical evidence, are formulated by experts, specifies the crucial requirements for facilities, personnel, and procedures, and can be used by regulatory agencies to accredit healthcare facilities and improve standards of care. Third, we also recommend stricter and swifter enforcement of present laws. For example, we have filed ethical cases against a physician involved in the current investigation with the Professional Regulatory Commission, PRC, more than a year ago and have yet to see any action. The potential of losing a medical license is a huge deterrent to malpractice, and only the PRC has the authority to revoke such a license. Fourth, it is our humble recommendation that an anti-solicitation law be enacted to prevent and punish solicitation in the field of medicine, as this creates a potential for unnecessary tests and treatments. We are thankful that this honored body has taken an interest in PhilHealth fund abuse. As the Organization of Ethical Eye Care Providers, we are ready to help develop solutions to this issue and to continue to support effective delivery of services throughout the archipelago. We are confident that collaborative efforts between professional, educational, and government bodies will succeed in curbing these abuses and in achieving the noble objectives of universal health care. A pleasant day to everyone.
Yes, thank you very much. Our representatives of the Philippine Academy of Ophthalmology, ma'am. Your recommendations are well taken. Please submit. I see that you read it, so therefore, could you just submit us the the written form of your statement. We would highly appreciate it. I also would like to note for the PRC, they already have filed cases, and sabi nga nila, it's been a year. Alam mo, kung file ng kaso at wala nangyayari, para wala rin kayong ngipin. Bakit naman po ganon?
Just like any other government agency, I think I mentioned this last time, that we have only about 25 lawyers, and serve, with 46 regulatory boards. So really, it's the lawyers who would schedule cases. Plus the fact that our setup in the PRC, there are only three rooms for the hearing cases. So we have mentioned this to the Commission already, and I hope they will address our question.
Okay, well taken. Next, could you please submit to the committee in the following next week all the cases, the number of cases filed, and how long they have been pending in the PRC, so we can see. I'm not too interested too much in who's being filed now. It's more of I'd like to see your backlog, so that we can see how much how the enormity of your problem.
I'll do that.
So we can take measures to address your capabilities, so that you can adequately address your responsibilities in society.
Can I just ask a question?
Okay. Please proceed.
Probably Dr. So.
Wait. Excuse me, sir. You address your question to the chair, and then I will ask Dr.
Sorry.
So.
Your Honor, I'd like to find out the accreditation as far as specialty is concerned, of those concerned specialists supposed to be. Apparently, all of these doctors did not follow the practice guidelines practiced by the Philippine Academy of Ophthalmology. So I'd like to find out whether they're really certified specialists. Because, as I mentioned before, we only classified 3 doctors: generalists, specialists. Specialists would refer to those with licensure examination, with training, and has been certified by the specialty board. The second classification would be subspecialists, those who are specialists and have underwent training for a particular specialty of that particular field. So I'd like to find out whether these doctors involved are really certified ophthalmologists.
Okay. Maybe Dr. So you can answer that later in writing, so that we can proceed to another point. But Dr. So, please answer that and furnish the committee of your answer in writing, but address it to the PRC.
We will do that, Your Honor.
Okay, thank you. In the spirit of fairness, I see that Dr. Heredia, you do want to speak.
Yes,
in
Your
the
Honor.
spirit of fairness,
Thank you.
Your institution has been mentioned, so
Yes.
please, we'd like to hear your side if you wish to say
Your
anything.
Honor. About the case of Mr. Martinez, we've been informed about this case in 2014. The doctor told about the morbidity of the fungal infection to us, and he assured us that he is taking care of, he's addressing the morbidity. In our exit conference last Wednesday, we were informed by Monday by Dr. So that there were 3 patients also who developed the fungal infection. We just want to clarify that there were 17 operations during that day, and there were 3 of them who developed the fungal infection. And after that day, there were no incidences of fungal infection that occurred or were reported in our clinic. Therefore, more investigation was done, and they found out that these 3 people were actually living close to each other. And we are not saying that they couldn't have gotten it in our clinic, but there were other people who did not develop it. Also, sorry, sir, just to add, after the exit conference, we also made a directive to do a fungal culture in our clinic, just to make sure that the standards are still upheld and there's no breach in sterility in our operating rooms.
Okay. Dr. So, you wish to say something? Okay, go ahead.
Just to contextualize lang po,
Excuse
no?
me.
Sorry.
At this point, I'd like to acknowledge the presence of our Senate President Pro Tempore, Senator Ralph Recto. Good morning, sir. Morning. Please proceed.
Thank you, Your Honor. Good morning, Senator. We just like to also reiterate, and we appreciate the efforts po being done by Borough, but one of the findings here is the fact that these patients were not followed up within the standard time of 48 hours. And I don't know if the experts can also explain on would it be possible that these complications would have either been prevented or at least addressed earlier if that was done. So that's basically amongst the issue, on top of what was mentioned, of course.
Okay. Thank you. The other findings, The other findings is the informing patients, Dr. So, informing the common grounds is informing patients of their rights. Could you please speak into the mic?
Yes, Your Honor.
And that eye centers, there are no guidelines in credentialing, and the word is privileging their affiliated healthcare professionals.
Yes, Your Honor.
What do you mean by that?
Your Honor, upon signing the performance commitment, these eye centers were actually asked to have written transparent guidelines on how they choose their doctors, that just to make sure that all of these doctors have the necessary credentials, as was mentioned by Dr. Doble earlier, that they are licensed physicians, that they have the necessary expertise to actually perform the procedures that they're doing. Privileging is actually making sure that they are capable of doing these specialized procedures that not all doctors can actually perform. So, for example, we'd like to think that only a heart surgeon can do open heart surgeries. So that's an example of privileging. Not all doctors are privileged or are able to do that. So these guidelines on how they do these things should be written. And when we monitored them and audited we didn't find any written guidelines on how they do these things.
Okay, thank you. If during the course of these hearings, if you wish to say anything more, especially the institutes that have been involved, please do so. Also, you can submit anything in writing. I understand one institute, Pacific Quezon City I, has submitted some documents to us, and rest assured we will thoroughly review your papers. Okay.
Thank you, Your Honor.
Yes. Sandali lang. We're here to talk about the privileging and the credentialing, so to speak, of institutions and informing them of their rights. I'd like to ask the doctor, si Dr. Barasi. Dr. Barasi, there have been several complaints against you. In fact, I have an affidavit here where the person alleging, and nabulag po ito, alleging that you performed the operation, yet the doctor that signed it is the doctor beside you who was not around. Ayon sa salaysay ng pasyente. So we have a case na kayo po ang nag-opera, iba yung nakapirma. You were suspended by PhilHealth. Why were you suspended to practice?
Your Honor, can I just read a statement of mine?
I want to read a statement.
Yes, Your Honor.
Okay,
Yes, Your Honor.
please do so.
Yes, Your Honor. Your Honor, I would just like to...
Please, the mic, yeah. Hindi ka masyado marinig. Yan.
Ipapakilala ko po muna ang aking sarili.
Sige po.
Sa aming mga kagalang-galang na senador, isa pong taus-pusong pasasalamat ang aking ipinaabot para sa inyong pag-aanyaya sa amin dito sa Senate Blue Ribbon Committee. Ako po ay si Dr. Christopher Barasi, isang diplomate ng Philippine Board of Ophthalmology at manggagamot bilang private ophthalmologist mula pa noong taong 2002. Ako po ay nanggaling sa probinsya ng Cagayan sa norte at sa aming munting baryo sa Enrile ay doon ko nagisnan ang hirap ng buhay at sitwasyon ng may sakit dahil sa kakulangan ng manggagamot. Lumaki po akong inasam ang maging doktor para sa aking mga kababayan at magsasakang kamag-anak. Nagsumikap po akong mag-aral sa UE Manila kung saan ako ay naging presidente ng College of Arts and Sciences Student Government. Ako po ay ginantimpalaan ng Outstanding College Graduate Award noong taong 1990 dahil sa ipinakita kong kakayahan sa aking academics at civic social activities. Nagtapos din po ako ng taon yon ng Bachelor of Science in Zoology, cum laude. Pagkatapos po ng kursong medisina sa UERM, nagtrabaho ako sa 24-Hour TV Japan, isang local NGO na suportado ng private citizens ng mga bansang Hapon, na ang layunin ay isaayos ang pamumuhay ng mga displaced families and communities na naapektuhan ng pagsabog ng bulkang Pinatubo. Sila'y aming inililipat sa ibang probinsya at tinuruang maging self-sufficient sa pamamagitan ng pag-organisa ng struktura ng barangay, pagturo ng basic healthcare at pagsasanay sa mga barangay health workers. Ganon din po ang aming ginagawa sa mga urban poor sa CAA Las Piñas, kung saan aming itinuturo at ipinaliliwanag ang karapatan ng mahihirap sa aspetong pangkalusugan. Nagtrabaho din po ako sa isang proyekto ng United Nations Development Program, kung saan ay nagsasaliksik kami ng paraan kung paano maitataas ang temang pangkalusugan ng pinakamahirap na bayan sa buong Pilipinas sa simple, epektibo at murang pamamaraan. Nakasama rin ho ako sa pagtaguyod noon ng DOH research on TradMed or Traditional Healing Practices in the Philippines. Noong 1997, ay pumasok ako ng residency sa Cardinal Santos kung saan ako ay naging chief resident. Bumalik po ako sa Cagayan noong 2002 upang magtayo ng clinic at magsilbi bilang eye doctor dahil na rin sa kakulungan ng ophthalmologist sa aming bayan. Dahil po sa aming karanasan sa buhay at exposure sa marginalized societies, ako'y naniniwalang karapatan ng bawat mamamayang Pilipino ang magkaroon ng mura, maayos, dekalidad at epektibong pagamutan. Kaya't malakas ang aking paniniwala sa Universal Healthcare Program ng PHIC. Sa tulong po ng PHIC at mga eye center at dedikadong doktor, ang epektibong public-private partnership na ito ay sa aking paniniwala ang sagot sa universal healthcare sa larangan ng ophthalmology. Mga mahal naming senador, nakatayong tatsulok ang hugis ng socio-economic population distribution ng Pilipinas. At ang pinakamalawak o pinakamaraming populasyon ay ang baba ng tatsulok, ang mahihirap, economically challenged, underprivileged Filipinos. Marami sa kanila ay nakikita namin araw-araw sa Pacific Eye. Hindi ko po kayang ipagdamot ang aking pagiging dalubhasa o kung sino mang kawani ng pamahalaan para sa kanila. Nawa po ay maliwanagan tayong lahat sa araw na ito na ang kanilang kapakanan ang nasa isip. Thank you, Your Honor.
Thank you. Pero okay, salamat po doon,
Yes,
ano? Pakilala po kayo.
Yes.
Pero ang tanong ko po, bakit kayo na suspendido? Pag yung
Privileges po.
why was your
Yeah.
privilege to
Yeah.
practice suspended?
For the record, Your Honor, it's a PhilHealth accreditation that was suspended.
Okay, I stand corrected.
Yes, sir. Can I tell the story again, Your Honor, of another one regarding this, why I was suspended, Your Honor? Can I just
Get
read?
to the point.
Yeah.
Why were you?
Yeah,
Why was it?
Your Honor, I was suspended because of certain allegations from a certain patient, which the PAO chose to believe. I was given a very heavy suspension despite the lack of due process. I say a lack of due process because they did not even have any documentation to support any of their findings against me. In fact, Your Honor, the patient filed a case based on the same events with the prosecutor's office in Taguig, who dismissed it for lack of probable cause. Now, contrary to due process, the PAO claimed that I intended to defraud the patient. After only appearing before the PA committee once to answer the allegations, the committee carried on to raise issues against me which were not even part of the complaint, depriving me of my right to know what it is they are after, if not just to answer the complaints against me by my patient. The presumption of guilt was evident from the start of their proceedings. Not only did I feel that I had been judged guilty without any factual basis, but also disrespected. In fact, they have their exchange of decision-making on the World Wide Web, which is the internet, easily accessible by the public. In their exchange in Yahoo, anyone can see the palpable anger, vindictiveness, and lack of objectivity. This is not something I expected respected colleagues to act. They even took the fact that I appealed their decision and asked for reconsideration against me. So what happened, Your Honor, is that their decision, they passed it to PhilHealth. Honor, I'll just get some papers, Your Honor. The PhilHealth then acted on it. So on April 19, 2013, they acted on it. They just take it per verbatim without any other hearing on my part. They didn't make any other hearing to hear my voice or to face the complainants. On April 19, 2013, because I am a diplomate of the Philippine Board of Ophthalmology, they reclassified me from a medical specialist to a general practitioner. Correct me if I'm wrong, I'm just a common doctor, but you can't reclassify a medical specialist to a GP because I have my proof that I'm a diplomate. Then I appealed this case. Then on November 12, 2013, they informed me that we regret to inform you that your accreditation has been canceled as of October 6, 2013. Their findings on ethical issues, suspension of membership in such professional organizations shall be given due consideration. I'm into this, Your Honor, due consideration. The PhilHealth being a... Sorry, Your Honor.
Would you like a few more minutes? Maybe we can ask while you're composing yourself the Philippine Academy of Ophthalmologists to shed light on the matter.
Your Honor, I was a member of the ethics committee when the patient who complained, lodged a complaint against Dr. Barasi was tackled. And we followed the rules of our, according to our code of ethics, we gave all parties a chance to give their side. In fact, during the unbanked meeting of the ethics committee, Dr. Barasi and the complainant were there. They were facing each other, and there were even situations that the patient raised, which Dr. Barasi could not, say otherwise that this is wrong. So for the committee, we took the patient's charges as we gave more weight to what the patient was telling us. And the ethics committee is just recommendatory to the executive council, and it is the council of the PAO that gives the penalties, the final decisions for such cases. And what Dr. Barasi was saying was that after he received the decision of the council, he was given a chance to file an appeal with our Council of Elders. Our Council of Elders is composed of past presidents of the Academy, and they were the ones who, they added more penalties to what the Council already decided on. That's
okay. The point is actually the merits or demerits of your suspension, Dr. Barasi. I would not like to delve on it too much, but if you wish to talk about it later on, in the spirit of fair play, we will do so. But The point is, when you made the operation on a certain Lilia Agudelo, you were suspended and you operated on the person. Did you know about this, Dr. Gosing Fiao?
Your Honor, as I mentioned before, Dr. Ong and Dr. Barasi are partners, and his privileges have been reduced so that he can only operate when Dr. Ong is around as co-managed, as co-surgeon, as based on Circular 31, series of 2013. I already mentioned last time that we did ask PhilHealth for permission before we did any of this, and they said yes, he can operate in our facility as long as he is co-managed, co-surgeon with an accredited physician.
Okay, let's stop there. You said you asked PhilHealth permission.
Yes, Your
Attorney
Honor.
Padilla.
They are probably talking about the pre-authorization po to conduct the surgery. But I don't think they asked the permission that Dr. Barasi himself would be managed. If you notice in the affidavit of the patient, ang sabi ho niya very, very clear na it was Dr. Barasi who actually performed the surgery and there was no other doctor present.
There was no other doctor
There was no
present.
other.
Itong sinasabing pre-authorization, this is a form that you fill up pro forma.
Opo, and it is based, sabi nga that the first hearing, it is really based on the honor system of the doctor, no? Na sasabihin sa amin na ito gagawin tong procedure na to, etc. No? But it does not mean that whatever procedure it makes is always valid. No?
Your Honor.
Yes, Dr. Gosing Fiao.
No, Your Honor, I'm not referring to the pre-authorization form. I'm actually specifically referring to permission that Dr. Barasi can operate in the center when co-surgeon with based on the circular po.
May permission daw, Attorney Padilla.
Hindi ko ho alam about yung permission na yon dahil ho suspended na ho si Dr. Barasi eh.
Dr. Gosing Fiao.
Again, Your Honor,
kailangan, meron po ba kayong pruweba na may humingi kayong permiso sa PhilHealth na despite suspendido si Dr. Barasi, pwede pa rin siya mag-opera?
Your Honor, may I read the circular signed by
Hindi po.
Yes.
Yeah, that's a general circular. You're saying
Yes, sir.
meron kang permission. So you're saying, Dear PhilHealth, Dr. Barasi will operate. Okay ba ito sa inyo? Then PhilHealth says, yes. That's a general circular. I have it in front of me.
Yes, Your Honor. Your Honor, it was a verbal question, verbal communication po.
By whom to whom? By whom to whom? By whom to whom?
By
Anyway,
I cannot recall, Your Honor.
okay. So now nandito tayo nahulog. So he said, she said, we said, whatever said. But anyway, ganito lang muna. Yes, Dr. Barasi, I'll get to you, no? That circular that you stated, Dr. Gosing Fiao,
Yes, Your
it
Honor.
says here, no, in page 4 of 6 pages, number 4B, it says, it is the responsibility of the healthcare institution, which is your institution, to inform PhilHealth members on the status of accreditation of their healthcare professional. Inform the patients of the status of accreditation. Now, I strongly doubt it's not in the affidavit of the victim, of the patient, that she was informed of the status of Dr. Barasi, that at that point in time, regardless, let's say, sabihin mo na may permiso ka, but did you inform the status of accreditation of Dr. Barasi to the patient? You cited the circular. I'm citing you the circular.
Can you repeat the question, Your Honor?
Sinabi ba nyo sa pasyente ang kalagayan ng doktor, ang status ng doktor na suspended siya ng PhilHealth bago inopera ang biktima?
Your Honor, the patient was co-managed by Dr.
Sinab-
Ong. Yes, Your Honor. But Dr. Ong is accredited, and
We're not talking about accreditation. We're talking about informing. Kung Tagalog, sinabi nyo ba sa pasyente? Ito, nandito tayo sa punto ng karapatan ng mga pasyente. And, Attorney Lutero, that's another thing you have to look into. Not just the facilities, not just the practice of the doctors, but more importantly, yung karapatan ng pasyente. Sinusunod ba ng healthcare facilities yung karapatan ng pasyente? And I'd like to commend PhilHealth for this because they're the ones that really pointed this out. Dr. Gosing Fiao, would you like to have a few minutes before you answer so that we can
Yes,
move
Your
on?
Honor.
Yes, okay. Dr. Brian Ongkian Kok.
Good morning, Your Honor.
Good morning. I don't know if the morning will be good for you, but ganito nangyari. Merong pasyente, inopera, ang nag-opera, si Dr. Barasi, and at that time, suspendido siya sa PhilHealth. Siya nag-opera. Pero pagdating ng PhilHealth claim, kayo ang nakapirma. Okay? Ngayon, Dr. Brian, kailan po kayo naging doktor? Kailan kayo na-accredit?
Good morning po, Your Honor. Your Honor, I ask if I can read the statement po.
I'm sorry, could you please speak louder?
Pwede po bang mag-read ng isang statement po, Your Honor?
Yes, could you please speak louder? Hindi kita marinig.
Your Honor, good morning po. Your Honor, pwede po bang mag-read ng isang statement po?
Pwede, pero sagutin mo muna. Hindi naman
Sige
komplikado yung tanong ko. Kailan ka naging doktor? Kailan pa ba ng statement yun?
Sige po. Your Honor, naging doktor po ako 2005. I graduated residency 2011. Then, naging accredited physician po ako 2013 po.
2013 ka naging accredited physician.
Opo.
O, sige. Go ahead. Now you can read your statement. Please proceed.
Okay, thank you po.
And please speak close to the mic. Medyo mahina boses mo.
Sorry. Good morning po. Ako po si Dr. Brian Bernardio Ongkian Kok. Nung aking kabataan po, ang aking pangarap ay maging isang manggagamot. Ang pagiging manggagamot ay isang bokasyon na kung saan serbisyo po para sa mga nangailangan ang pangunahing layunin. Ang bawat pagsisikap at pagtsatsaga ang ginagawa upang matugunan ang problemang pangkasalukuyan ng ating mga mamamayan. Kadalasan po, ang isang manggagamot ay naghahanap ng mga kagamitan at medisina upang mabigyan ng lunas ang sakit ng mga ating nangangailangan na pasyente. Hindi po ako nagsisisi sa pinili kong bokasyon. Hindi ko lang po pangarap na yumaman sa pagiging isang manggagamot. Maraming salamat po.
Okay, Dr. Brian Ongkian Kok. Since 2013, naging accredited. May accreditation kayo.
Opo.
Okay. So today is 2015. 13, 14, 15, 2 years. Okay.
Opo.
From 2013 to 2015, you were able to, and I'd like the Philippine Academy of Ophthalmologists later to react to this. From 2013 to 2015, you were able to perform 3,000 23 operations. That's commendable. 3,023. And your claims amounted to almost 40 million, 39.9 million. For such a young doctor, you do certainly are very prolific. Let me read. Pacific Eye Center of Makati, 236 million. Pacific Eye Center of Laguna, 2.4. Chinese General, 700,000. Eye Wellness and Correction Center, 129,000. Manila Adventist, 13,000. 3 years, 2 years, 40 million. Pinaano ko sa staff ko, this is about four operations a day, Monday to Sunday. Monday to Sunday. I don't know. You're very, I think, I don't know what your secret is. Maybe you should share it with the other doctors because you seem to be a very successful doctor.
Thank you for your honor. Your honor, I'm not really affiliated with Manila Adventist, your honor. Your honor,
this is taken from PhilHealth.
Your honor, hindi po ako affiliated ng Manila Adventist Hospital po, your honor. Your honor, may I read yung aking census na natanggap po?
Go ahead. Yes, please
okay.
do so.
So, okay. Good morning po, your honor. We've done 2,727 cases. Some of these cases I personally done.
Ilan po?
2,727 cases.
2,727 cases.
Yes po.
That's still a lot, huh? For
Yes.
2 years.
Yes.
For a young doctor.
The duration po is nung November 2013 hanggang May 2015. Okay? So, based on this census, your honor, equivalent po neto is not amount to 36 million o kaya 40 million. May I kindly ask your office to give us permission to ask the fine gentleman in PhilHealth to at least enlighten us naman kasi nagkakaroon ng medyo clear kung pwede lang po.
Most certainly, pwedeng-pwede.
Thank you po.
Dr. Padilla, I see you raising.
No, I just want to, Your Honor, to clarify. He said some of these cases I did when you did your opening statement. So some you did not do, some you did. And I heard him say that, so I wanted
Yes,
to
I seem
clarify
to,
that.
Dr. Brian, yes, I seem to remember hearing that.
I just wanna state again that we have done as co-surgeons.
You're pointing to Dr. Barasi?
Yes po.
Okay.
We have done as co-surgeons, and there are some cases that I only personally do. Ako lang po na gumagawa. May mga kaso po, sir, your honor, sorry po, na kami po gumagawa. May mga ibang kaso po na ako lang po ang gumagawa.
Let's go to the specific case. Ito. Okay. Si Dr. Barasi ang gumawa, suspendido siya. Ang nakapirma, ikaw. Siya muna. Then we'll call you.
Your Honor.
Go ahead.
Kadalasan po ng mga cataract surgeries, no? Si Dr. Barasi po ang gumagawa.
Hindi.
Ay, kaming
Let's
dalawa.
just talk about this particular. Gusto mo pangalanan ko yung tao? Kasi yung affidavit ng tao, walang si Dr. Barasi lang ang gumawa. Wala ka doon.
Your Honor, if ever mga cataract surgeries, kaming dalawa po ang gumagawa ng cataract surgeries po, Your Honor.
Sabi nga, wala ka doon eh. Sabi ng ano.
Your Honor, meron po kaming authorization, consent form po na nagsasabi po na ako po at si Dr. Barasi po ang nag-opera sa kanya. May witness po dito. Yung witness po is her granddaughter.
Okay, we'll take that into account. Please submit that and please furnish also the internal audit of PhilHealth because I'm sure they will be very curious as to that. Sige. Yeah. Senator Recto?
Thank you, Mr. Chairman. Just a follow-up question to PhilHealth regarding this issue. No? Narinig natin na mahigit 3,000, whether it's 3,000 or 4,000 or 2,000, no? Napakarami ba talaga nun?
Marami ho yun. Napakarami ho talaga nun. In fact, dahil nga ho dito sa mga pangyayari na to na parang marami, nagkaroon ho kami ng panibagong utos sa kasalukuyan, limiting the number of cataract patients that a particular doctor can have.
Okay.
So nililimit na lang ho namin at 10 per day or a maximum of 50 per month. No?
Okay.
Kasi ho, kung tama ho yung sinabi ni Dr. Brian, 2,727 ang kanyang naging operasyon. In the 19 months, that would total to 144.
Okay. At lahat yan, let me go to the point now, no? Lahat yan ay PhilHealth members.
Lahat ho yan PhilHealth members.
Hindi 86%.
Oh, no.
So, the total universe ng lahat ng pasyente niya conveniently are PhilHealth members.
Well, kasi ho sa kanilang pagre-recruit, ay talagang hinahanap nila ang PhilHealth members.
Okay,
Opo.
I understand. No?
Yeah.
At kayo ba nagbi-withholding tax din kayo pag nagbabayad kayo ng tawag dito ng professional fees?
Ang binabayaran ho namin withholding tax, yung binabayad namin sa hospital, and then we expect the hospital ang sila ang mag-withhold para sa mga doktor na bibigyan nila.
Okay. Nalaman ba ninyo kung winithhold ng hospital yung professional fee na binayaran nila?
I think meron naman ho. Hindi ko ho matitiyak kung lahat. All the wala na ho kaming basihan doon.
Okay. Kasi nakakapagtaka kung ganun kalaki, 40 million ang kinikita niya taon-taon sa PhilHealth, malaking buwis din ang kailangan bayaran dyan.
Tama ho yan. In fact, meron mga hinihingi ho sa amin ang BIR kung minsan tungkol sa mga income. No?
Okay. At nakakagulat dito ay yun nga na 100% PhilHealth members.
Opo, kasi ho, ang layunin ho kasi ng mga gumagawa nito ay talagang makakuha nung 16,000 reimbursement na binibigay ng PhilHealth. So they can give it for free or sometimes humihingi pa rin sila ng bayad over and above what we pay. So yun ho ang layunin nila talaga.
Are they admitting that they solicit, naghahanap sila ng pasyente ba talaga na PhilHealth members?
Opo.
Inaamin nila yan?
I think inaamin, pwede ho natin tanong sa kanila. Pero
may marketing kayong ganon?
Your Honor, wala po.
Wala. O sige. Anyway, let me, one last final point before I reserve my right to ask questions later on. Ano? Kailan ninyo nalaman na itong scam na to? Paano nyo nalaman na may scam na ganito? Sa mga eye centers, eye doctors.
Marami hong insidente, may mga nagrireklamo, meron mga pinaparating ang PAO ng mga kanilang mga investigasyon, meron yung actual complainant. I think nag-umpisa ho dito siguro na meron mga gantong aligasyon couple of years or so ago. Tapos yun ho, tuloy-tuloy ang
Meron na ba kayong internal audit na ginawa sa PhilHealth? Dahil mahirap isipin na magagawa nila yan na walang kasangkot sa loob din siguro. Kasi nagbibigay ng accreditation, nagbabayad.
Oho.
Ito ba nabayaran lahat itong mga to?
Nabayaran ho to.
So nabayaran
ho to.
na.
Opo.
At nagkaroon ba ng audit ang COA halimbawa? Nagtanong sila, bakit ang laki-laki ng binabayaran niyo sa mga to? Which
Sa acting,
started the process of an internal audit of some sort?
actually ho, dahil ho sa aming operasyon at sa pag-audit mismo na dumadating mga datos at statistika, we started the process itself.
So kayo mismo?
Opo, opo.
Internal audit group ninyo?
Opo. Ito nga ho, findings ho ng internal audit ho to.
Wala kayo nakitang posible may kasangkot sa loob ng PhilHealth?
Well, ang sabi ko ho earlier, sabi ko, laging may posibilidad na meron, ano? Pero in this particular case ho ito, if we follow the money, lahat ho ng pera talagang napupunta ho sa institution, sa healthcare institution. At I think wala na, well, unless meron hong allegation, wala naman ako naririnig pa.
Wala naman.
Tungkol sa specific persons or officials in PhilHealth, wala naman ho. Wala
naman. So wala kayong internal audit report na nagsasabing may kakonsyaba sa loob ng PhilHealth?
Not with this ho. Wala pa.
But with others, meron?
Meron ho. Meron ho mga ibang insidente na ano na talagang miski sarili namin mga tao ay hinablan namin.
Okay. Ito bang ganitong modus operandi nangyayari din sa mga ibang public hospitals?
Ang datos ho namin is that
or
mostly
majority sa pribado?
Mostly ho sa pribado. Kasi ang pinakamalaki hong binabayad namin pagdating ho sa Catarata are ito nga, no? 9 out of the 10 are eye centers, private.
Ako, palagay ko, maliwanag na yung pagpupulong natin dito eh.
Opo.
Later on, we should find out how do we strengthen the law para hindi maulit itong mga to, no? Pero ako, nagtataka din ako sa lahat ng dating sinabit niyo dito sa committee, ay mas malaki ang kinikita ng mga pribadong hospital, hindi lang ng eye center, kaysa sa public hospitals. At ito matagal na natin na pag-uusapan to.
Talagang
it
gusto...
would appear that 2/3 of your 78 billion go to private hospitals and not to public hospitals.
Actually, Senator, talaga ho ang gusto ho sana ng PhilHealth ay magbigay talaga ng premium or mabigyan pansin, no? Ang mga public. We know that the public hospitals require our funding for a better equipment, better facilities, etc. Kaya lang ho talaga sa claim namin, talaga ho either mas ma-efficient ang mga pribado in filing their claims at yun ho ang mga nagiging problem. But even our no balance billing ay para sa public hospitals lamang, etc. No? Meron ho kaming ganyan. Maluwag rin ho kami sa mga ilan patakaran sa mga public hospitals. Kunyari ho, yung overcrowding or overbed capacity. Maluwag ho ang PhilHealth yan. Pagdating ho sa public, mas mahigpit ho kami pagdating sa private.
Remember, Attorney Padilla, we just discussed that most of these fraudulent cases are in the private sector.
Tama ho.
At halos wala kayong kasong fraudulent sa mga public hospitals.
Tama ho yan.
At maliwanag din sa data natin, 2/3 go to the private sector ng pondo ng PhilHealth. At tinatanggap din naman ninyo na kaya hindi natin ma-improve yung health facilities ng public hospitals ay napakaliit ng binabayaran sa public hospitals kumpara sa private sector. Tinaasan natin yung premium, tinaasan natin yung subsidiya ng national government sa PhilHealth, yung demand natin for health services, tinaas natin, pero yung supply hindi natin ini-improve. Yung health facilities, di ba? Kulang na kulang pa rin. No? Now,
kaya nga ito ho ang partnership, or hindi naman partnership, we are an attached agency of DOH. Taon-taon ngayon, meron na rin ang DOH ng sariling pondo at budget for the health facilities enhancement. So, doon ho, nakakatulong
sa DOH. Tama yun. I agree with that. No? And I think we should do more for that. No? Now, having said that also, napansin ko rin at I will move on that later on, but just for food for thought at this point in time. sa indigents natin, last year, ang budget na binigay natin, 37. Palagay ko, karamihan dito, indigents din yung mga pasyente, palagay ko eh. Ha? 37 billion yung subsidy ang binigay natin sa indigents. Pero ang benepisyong binigay natin sa indigent ay 25 billion lamang. And considering that the indigents, yung pinakamahihirap na natin, ay 50% miyembro ng PhilHealth. Bakit napakaliit ng itinutulong natin sa mga indigents natin?
Di naman ho sa on purpose yun or designed that way, no? I think malaking bahagi rin dyan ay hindi nalalaman no, ng ating mga mahihirap na automatically miyembro na sila ng PhilHealth.
Correct.
At
Ang palagay ko, may pagkukulang din dyan ang PhilHealth.
Ay,
Hindi lang
totoo-
ng indigent.
Totoo ho yan, totoo ho yan.
Yung listahan ninyo ng mga miyembro ng indigent ay hanggang sa ngayon ay hindi ko pa rin nakikita. Halimbawa, yung sa CCT, 4.5 million families yun. Scattered all over the provinces. No? Dapat yan may database tayo. Now, let me point this out before I turn it over to the chairman. Ha? Ito, 100% ng pasyente niya, PhilHealth, at binayaran ninyo. Yung mga public hospitals natin, sa Lipa, o sa Halimbawa sa Batangas, we have 12 district hospitals. We have 350,000 outpatients a year. 59,000 inpatients a year. Kung titignan ko yung statistika ninyo dito, your average payment sa claim ng PhilHealth is roughly 11,000 pesos. Ilagay na natin ng 10,000 at 59,000 inpatients, dapat nakakakolekta kami sa inyo ng 590 million. O times 86% na lang at hindi 100% miyembro. Eh di mahigit 500 million pa rin yun. Hindi na namin kailangan na subsidiya galing sa national government. Kaya na namin pagandahin lahat ng hospital namin. Pero nakukuha lang namin is, 100 million? Ang bilis-bilis niya magbayad sa mga eye center nito at nabayaran. At doon naman sa mga local hospitals, hindi na mabayaran. So yun lang ang gusto kong ipunto rin dito. No? Baka naman, may kakonsyaba kaya nangyayari dito. 70% goes to the private hospitals na fraudulent. At baka mamaya later on, may kickback sila sa mga hospital na yan.
Pero sir, ang ano ho namin dyan is that I think wala na ho yatang institusyon or hospital na hindi namin nababayaran from a valid claim within 60 days. In fact, napabilis pa nga ho
Attorney
kami.
Padilla, alam ko bibilis naman kayo. I have no problem with that. Ulitin ko lang 59,000 patients kami sa Batangas last year or 2013 if I'm not mistaken, inpatient. Following your data, 86% ang miyembro. In fact, the default today is you go to a public hospital, you are a PhilHealth patient. That should be the default. 86% ang membership natin. Nagbigay na ng subsidy ng national government na may 37 billion eh. Di ba? Now,
Tama ho yan.
in Batangas, chances are we're 100% covered pa nga eh. Hindi lang 86% eh. Kasi malakas yung formal economy namin dun eh. Di ba? Okay. So, at yung mahihirap, hindi pupunta ng pribadong hospital yan eh. Pupunta sa public hospital yan eh. Wala naman private hospital sa maraming munisipyo, sa maraming syudad sa probinsya eh. Pero may public hospital doon, may district hospital doon. May barangay health center doon, may RH unit doon. So, ang karamihan na mahihirap pupunta doon sa mga hospital na yan. Hindi sa pribado. Pero, hindi namin nakokolekta yung dapat makolekta. At hindi lang ito sa Batangas, sa buong Pilipinas. At dito nga sa indigent pa lang, kitang-kita na. At kung titignan ko yung, tawag dito, yung financial statement ninyo, ang pinakamalaking pinagkikitaan din ninyo ay yung indigent, sumalabas. Ang income ninyo noong 2014, 4.7 billion. Ang benefits na binayaran nyo sa indigent, 25. Ang nakolekta nyo, 37. Eh di karamihan ng income ninyo galing sa indigent. Bakit? Hindi kasi walang database yung mga miyembro nila. Eh bakit ako nagtataka ako? Bakit sila 100% database tama sa kanila? Kaya siguro ang gusto ko sabihin lang ay Pag-aralan ninyo na mabuti, dahil palagay ko hindi magagawa nila to na walang kasangkot sa loob din. Posible. At karamihan ng mga pribadong hospital na may mga fraudulent practices, ay posibleng ganun din na nangyayari. Now, sayang naman lahat ng pondong ito. Lahat ng subsidiya na binibigay din natin dito, kung dadami pa ang mga fraudulent cases na to. No? So, nakakalungkot na may nagsasamantala at posibleng may nagsisinungaling dito, ha? Na nakakagulat na yung mga mas malaki pa ang kinikita lang sa mga ibang hospital namin eh. Eye center lang to sa amin, karamihan sa panganganak pa lang eh. No? So, with that, Mr. Chairman, thank you for the opportunity. I reserve my right later on again to ask some other questions. Thank you.
Yes, thank you. I see someone to respond. Please be brief, but the hour is late, but we will allow everyone to respond. Dr. Evangelista?
Yes, Your Honor. I'd like to respond to Senator Ralph Recto. When we started the Pure Health Cataract Surgery Program in 2004 in our private clinic, our objective was to help out the people who couldn't pay on top of PhilHealth. That was way back in 2004, and this program was copied by PhilHealth in 2011. So we were the one who started this. Now, when we studied all this, we found out that the problem basically back then was PhilHealth was not paying properly, they were delayed. But as time went on, they became efficient and they started paying quickly. But the main problem
nababayaran kayo.
Yes,
hindi
opo.
nababayaran yung public hospitals.
Opo, dadating, yun po ang point ko. Kasi po, napag-aralan ho namin na ang rason pala kung bakit hindi nababayaran yung mga ibang ospital at yung ibang mga facilities, kasi po, mali yung pag-file nila. They don't file it correctly. They don't have efficient filing because they have 60 days to file. What other people or what other government hospitals do is they wait 60 days before they file it, and by that time, they may have lost the file already. If you will look at the statistics in government hospitals, the utilization of PhilHealth in those government hospitals are very low. It's not because they don't file, it's because they don't file efficiently. It's because they don't know what to put there. It's because they don't take time to study the rules of PhilHealth, what to put there, how to accomplish it properly. In our center, Your Honors, if you do the surgery today, we file it tomorrow. In government hospitals, you do it today, you get the papers get lost, and I think I am correct when I say if you check the way that the government hospitals and even other private hospitals, they have not fully modified their system or studied the system so that they can file accurately. And I think when they do, I think PhilHealth will see a tremendous rise in the utilization, Your Honors.
One thing is for sure, I know that in Batangas we do not file fraudulent claims like many of the eye centers do.
Your Honors,
that's how it would appear to me.
Your Honors, I would like to state for the record, the Quezon City Eye Center has not filed.
I would like also to state for the record that in Batangas, I think they're able to file efficiently.
The cases that you mentioned, Your Honor, I'm sorry. I'm sorry, Your Honors. It's just that from the numbers you stated, you should have been paid more than what you have.
That's precisely what we're saying.
Yes, that's
what I'm saying. And this is not only
saying.
for Batangas but nationwide.
Yes.
Now, what I'm saying is that I am surprised, and I don't think that because you are so efficient compared to the others, that many of you are getting paid 100%. Okay? I'm saying that it is possible that there might be collusion with some PhilHealth employees, that immediately when you file, they process your claim and you're paid. Because the general data would show that 70% of all benefit payments go to the private sector and 30% to the public sector. Whereas kung titignan naman natin, karamihan ng pasyente, lalo na sa probinsya, will go to the public hospital and not the private hospital. So that's all I'm saying. Thank you.
Dr. Evangelista, just a follow-up. What percentage of your patients are PhilHealth members?
We looked at it. It's around 75, nearly 80%, Your Honor, but not all. We do have a lot of privates, and we do have a lot of charity patients also, the ones without PhilHealth that we do procedures on. And then we can show the numbers, Your Honor, if we're not 100%.
Is it true you stopped operations?
Yes, Your Honor. Because of the stop payment claims, no doctor would come to our facility now to do the surgery, so we're effectively shut down.
But 70% of your patient population comes from PhilHealth members?
Yes,
more
yes,
or less,
Your Honor.
more or less.
Yes, Your Honor. But everyone's affected. And may I just add, Your Honor, Attorney Padilla mentioned that 9 out of the 10 top doctors are ophthalmologists paid by PhilHealth.
I never said 10 doctors. I've always said 10 eye centers. Wala ko akong binabanggit na doctor.
In the Philippine Star,
that was a misquote, which we corrected, which we responded to the next day. No? Dahil I never said that 10 doctors were receiving.
Okay, so he disclaims it now.
Just a clarification, Attorney Padilla. So you're saying I did not get 50 million pesos?
Sandali po. Let's address it to the chair, and then the chair will.
I'm sorry, Your Honor, because in the Philippine Star, if you read it, it was said there that there were 10 doctors who got an average of 50 million each. And unfortunately, Your Honors, I was named as one of them by Philippine Star. And I have my vouchers, I have my 230, everything. I can't even come close to a fraction of that. So,
Your Honor, this was part of our Senate report. When we said that there were 10 out of the ambulatory surgical clinics, there were 9 out of the 10 were eye centers. And then we also mentioned that in 2013, these eye centers received 500 million in 2013 and 700 million in 2014. I could not have said that 10 doctors because I don't know how much income the doctors actually receive from our payments. But as far as income from the PhilHealth is concerned, it was on eye centers. That's very clear, Your Honor. That was a misquote.
Okay, point well taken. Dr. Brian, do you want to say something?
Yeah, let it be clear, Your Honor, that I didn't receive 40 million. Then, so how much did you receive? If you didn't get 40 million, how much did you receive? You know, by your own admission, you said 2,727 cases. Okay? Now, divided by 547 days, that's 5 cases a day. You operate 5 times a day, Monday to Sunday. I don't know if, let's ask the ophthalmologists here if somebody can really physically do that.
Your Honor,
No. We're asking him a question. You offered some information, and now you want to say that I'm asking you a question. If you say you did not receive 40 million, then how much did you receive? Sinasabi mo, hindi. So, ano yung katotohanan? Base sa'yo.
Your Honor, around 15. 1.5 lang po.
1.5?
Yes, then divided pa po by...
Oh, let's finish your statement. Divided by... Do you want to finish your statement, or that's the end? Before you... sige, let's finish your statement.
So ngayon po...
15 million, that's what you're saying?
Yes po.
PhilHealth, can anybody in PhilHealth please react? Because the data came from you. Dr. So?
Thank you, Your Honor. We'll just be clear po, no, na like we said, we pay case rates. So the total amount of money was paid under the name of Dr. Brian on Kiancok, pero paid as a case rate in full to the different facilities. Number one of those facilities is Pacific Eye Institute in Makati, which got a total of 36.6 million pesos po for the surgeries done by Dr. Brian on Kiancok po. This is from our database naman po.
36 million.
So admittedly, that's the whole case rate po, no, that was paid. Now, the Manila Adventist, there was mentioned po earlier that he was not affiliated. In our database po, just to be clear, there was just one claim po named after him po under Manila Adventist po. We're having it validated now, sir. So that's from the number of claims paid po to these different facilities.
Mr. Chairman, just to follow up on that.
Yes, sir.
You nabanggit mo, how much? 36 million?
Sir, paid to Pacific Eye Institute Makati for surgeries done by Dr. Brian.
Correct. Okay. So 36 million, 40% will go for professional fee, di ba?
Sir.
So that's where the 15 comes in.
Yes.
So tama yung data nyo. More or less. If I calculate the 2,700 times 6,400, it's about 17 million nga eh. So thereabouts. Now, there was a comment behind us here. Dapat karamihan na staff, nag-ophthalmologist na lang eh.
And I'd also like to ask Dr. Margarita Latluna of the Philippine Academy of Ophthalmology. 5 operations a day, Monday to Sunday. Is that realistic? Is that for a doctor who just has been accredited?
If you just finished your residency, it's very unusual for a doctor to be operating on 5 patients a day for Monday to Saturday during your Monday to Sunday during your first year of practice.
Okay, point well taken. Dr. Padilla.
Thank you, Your Honor, because as I told you earlier, I will have to leave earlier and I want to ask permission. But before I do, Honorable Senator Rector, you were not here earlier when I made my presentation. And remember I said one of the problems of government institutions is that many of the private institutions, whether they be eye centers, clinics, they are in cahoots sometimes with the local government. So that they either pay them a kickback or they're in business partnerships with them so that the NBB patients, the government-sponsored patients, are recruited towards the private, thereby depriving the government hospitals of what they should really be doing. Now, this particular case...
That's a general statement,
no,
Dr. Padilla.
In many.
No, precisely.
Yes.
I want to find out where.
Yes, can I give you a list?
An example? Yeah.
Well, this one today. The patient went to Pasay. Sino hong pumunta sa Pasay City Hall? Si Mr. Fernando. Pumunta siya sa Pasay City Hall. Ang sinabi sa kanya, pumunta ka sa Borough.
Pumunta saan?
Borough Eye Center, which each of private eye clinic. Now, why didn't they tell him go to Pasay City General Hospital? Why specifically to this eye center? Now, when he got complications, what struck me was that they sent him to Pasay City General to see an ophthalmologist about the complications. So that means they have an ophthalmologist who can manage perhaps complications. So why not refer to the government hospital to start with? It's a common practice.
So my question is, but to generalize
I'm saying
all
many.
LGUs.
No. Many. No.
Yeah. And to say that an individual represents the LGU is something
No, not also, yes. But I'm saying that there are people within. And I think the Philippine Academy of Ophthalmology, if the committee wishes, we can give you some lists later on. But I'm not ready to say them in public.
Okay.
No?
And it's also possible that there are referrals naman, di ba?
Your Honor, from what we see, it isn't so much a referral but a solicitation system.
Okay.
The solicitation is that they go door to door, house to house, a barangay, and then
Nagre-recruit.
talaga ho nagre-recruit because they give them perks, enticement, and sometimes even pay patients to have their surgery there. It's a whole system.
So you're saying that this is not only happening in
eyes,
ophthalmology or eye centers, but
we find that the system is being replicated for others, like
such as,
for example, recruitment of families to have checkups, for example, And when they go there, they say the checkup is free. But then they do procedures on the patient, like very little procedures, no? And then say, okay, walang problema, wala kayong problema, discharge them, and then they get shocked that they have claims for pneumonia or other diseases with PhilHealth.
And these are happening in private hospitals.
Yes, usually small private hospitals and centers. I don't think it's happening in government. But that being said, there is some truth to what Dr. Evangelista said about delayed filing, because I do surgery in a particular government hospital, and I noticed that the payments to the doctors are very, very delayed. Kasi ang ginagawa, they pull it together before they submit the claim, and that can also delay the payments. I'm not saying it for all, but in the particular hospital I work in, ganun ho nangyayari. So yun din ho. But again, your question kung may kasabwat sa loob, I believe it's really possible, and in fact, PhilHealth has filed cases already against some insiders who are been in cahoots.
Thank you very much. Thank you.
Yes, we're talking about insiders, and we're talking about, I'm also very concerned about hindi lang tayo mag-imbestiga tapos wala na naman mangyayari, no? Dr. Padilla, Attorney Padilla, would it be possible, please submit na lang, a status of the cataract cases as of this time, of all the cases within PhilHealth, and their present status. Attorney Padilla, what is CAAC?
CAAC it's a committee of the board.
It's a committee of the board of PhilHealth.
Of PhilHealth that deals with appealed cases.
That deals with appealed cases.
Opo.
Okay.
So, ang nagde-decide ho yan is a board committee, and then make a recommendation to the board itself kung ano yung magiging decision.
Kung ano yung magiging decision. Pag nag-decide na si CAAC, ano po mangyayari? Let's say, ang decision is you have the right to suspend the license.
Yeah.
Or
magiging executory na ho yun, it will be confirmed by the board.
Has it happened?
Oh yeah. Nangyari na ho yan. Nangyari na ho yan, pero meron yata mga backlog pa.
Okay. Would you submit the status, and
cases.
Please inform the CAAC members that they are cordially invited to be present in the next hearing.
Okay po.
Yes. Now, in the spirit of fairness, yes, Dr. Barasi, I remember that we interrupted you because, upon your request, of course, no, that you be given some time to compose yourself. Now that you're raising your hand, okay, please proceed.
Your Honor, first of all, I would like to strongly deny, Your Honor, that I am the only one present during the operation of that patient. We have co-managed most of the cases, me and Dr. Ong, Your Honor. And regarding what, with your permission, Attorney Padilla, regarding what Attorney Padilla had said about the CAAC, I would like just to clarify, because I'm just a doctor, Your Honor. I had a motion for reconsideration dated February 10, 2014. And it says that we have forwarded your MR to PhilHealth Board of Directors through the CAAC against healthcare providers. That's on February 10, 2014. Until now, I haven't received any other answer from them, Your Honor. And with regards, Your Honor, I would like to be clear with regards of the statistically impossible. Most of the ophthalmologists here would say, the efficient ophthalmologist would prove to you that it is possible, Your Honor. If we can give you all the statistics that we do. For example, Your Honor, in phacoemulsification, we co-manage, excuse me, Your Honor, the co-management, it's a very common practice in ophthalmology. They're partners. We usually do that. In phacoemulsification, for example, in 2014, we have 705 phacoemulsifications or cataract surgeries. If you compute that per month, from 10 months, because we started being a co-doctor from March of 2014 to December of 2014, that's a 70.5 per month. Since we do it 2 to 3 days a week, Your Honor, that's a 17.6 a week, which is just around 3 a day, Your Honor. And the surgeries, if I may clarify again, Your Honor, the one that 2,727 claims. All of the ophthalmologists here would know that not all of these are very difficult or time-consuming surgeries. The phacoemulsification, if you're efficient enough, especially if you're co-managing, it amounts to around 10 to 15 minutes per eye. The lasers, take note, the lasers are, you can only do it in a span of 5 to 7 minutes. And what's so very advantageous to group practicing is sometimes I see patients, then he does the laser. So it's more time managing. But there is not time for, there was never any time that I do surgery without him. Maybe we can give you all of the numbers, Your Honor, just for you to, yeah.
Okay, please submit everything. But
Yes,
I'd like to say that, there's some affidavits here and your name keeps popping up.
Yes, Your Honor.
There's a saying, where there's smoke, there's fire. Okay, please be brief. The hour is late. Those who want to say something, we will have other hearings. So please just inform us in advance if you want to say anything. I'd like to emphasize that everybody should be given time to air their side.
Sir, sorry.
Oh, Doctor, yes. Oh, sige.
Can we ask for a copy of the affidavit, Your Honor, so we can reply to the one that you were referring to? Your
PhilHealth, Dr. So, please, Attorney Padilla, please provide Dr. Barasi a copy of the affidavits.
They will, sorry ho. Pwede naman ho, it's still under investigation, so I think they will be given the time and opportunity to actually answer it.
Okay.
Your Honor, last week, last hearing, we talked about the bill of particulars that we were asking for. We still haven't received them.
Attorney Padilla, the bill of particulars. Yeah, I do remember that. Yes, you did say that, Dr. Gosingfiao.
Well, this is an administrative inquiry or investigation. Let me just cite some of those questions that they are asking bill of particulars for. No? It was very detailed. It was very, they wanted to know not only the patients, they wanted to know the incidents, they wanted to know whether or not who said it to who, etc. No? So answering all of those questions will also take some time, when the simpler thing is simply to conduct the investigation and for them to respond to it. No? So we'll just give you a copy of the bill of particulars.
I don't need, the committee doesn't need a copy.
Okay,
It was just a request which you responded to last hearing. Okay.
So I take it we will get a...
Ayun, Attorney Padilla, did you say you will get a response?
Yeah, they will get a response.
They will get a response.
Yeah, from that.
Okay, Doctor.
And also, I'd like to take this opportunity to, because last week, when Dr. Robertson mentioned that Ate Yoli went house to house, I'd like to take this opportunity to deny that.
That Ate Yoli, a so-called seeker, went house to house.
Yes, she's not a seeker. So...
What is she then?
She's a liaison officer po.
Liaison officer. And what does she do?
She liaises po. Your Honor, she does get called by
a liaison officer, liaison. Okay. You want to play around with words? That's your
Honor, she
prerogative.
gets called by LGUs to present what the LGUs and senior citizen groups to present what we have in the center. So that's what she does. She goes and presents, and then most of the time, actually, she just, she gets Meralco and all that stuff.
Sige na. Yeah. Sige, we take note of what you said. Thank you.
Your Honor, may I just cite some of the questions? What do you mean by sample patients? What is the meaning of seeker? What activities constitute marketing and advertising? What activities constitute marketing, advertising, and what would constitute recruitment? How were these patients recruited? These were the questions that they want us answered. Your Honor, actually, the more that we delay in trying to answer these questions, the longer also the staff payment holds, no? Dahil there is no meeting of the issues in this concerning this. Marami mga question. What did the patient say to the alleged seeker during the alleged recruitment?
Well, yes, Attorney Padilla, but that's internal to you. That's internal to the administrative case.
We will respond na.
I think it just means that their lawyers are earning their attorney's fees.
Yes, opo. Yeah. Sige po, we will respond.
Your Honor.
Lastly, Dr. Cosing Fiao.
Your Honor.
It's 11:56.
Yes, Your Honor. It's just that we're being scrutinized in public, you know, and all of this came out, and as he said, it's still for investigation. We have not had the opportunity to respond yet because kulang pa yung data, and we take this seriously. So we want to respond accurately.
Okay, well
Mr.
taken.
Chairman, just one final point. Attorney Padilla, bakit yung cataract nga pala 16,000 yung presyo na binabayaran ninyo?
Yan ay nandyan na when I came in also.
I want to find out why. Ulitin natin yung tanong, ha?
It's subject raw of a study conducted with the help of some public institutions and private institutions. Namili from several all over the country. Tapos ito sabi, ito raw ay kinonsulta rin sa mga specialty societies, etc.
Okay, I understand, Attorney. Sufficient explanation for that. Now, magkano yung panganganak?
8,000 at cesarean 19,000.
Okay, so ulitin ko lang. Yung panganganak, 8,000. Cesarean, 19. Cataract surgery, 16. That's my point. It is designed that way. Why nakikinabang sila instead of MDG natin, maternal health care, panganganak, so on and so forth. Pero ang baba naman ang binibigay natin. Yun yung pupunta sa public hospital So, I think that the PhilHealth and the Department of Health should seriously study how you determine. Remember, your average claim is only 11,000. But then you're paying for cataract 16.
Wala naman hong value yung case rates namin. It's not cast in stone. Yes. We have actually reduced some incidents and we have also increased. Meron hong mga iba. We have also delisted some procedures as we continue as we go on. Kunyari pagdating sa cesarean,
Baka mamaya the people designing this are the ones in cahoot with certain professions.
Well,
diba? That's the point. I mean, clearly, I look at the numbers and you see something wrong with it.
Marami hong consideration. May I just mention yung cesarean, yun that we pay 19,000. I know that it is, many of the hospitals are saying maliit raw yun. Yung binabayad namin 19. If you really go through a cesarean. Ang sinasabi naman ng PhilHealth is this. Right now, ang mga births through cesarean is more than 30% of all births, which is over and beyond the international average. I think mga 15 to 20%. So ang sabi ng PhilHealth dyan is that kung mababa man yan, so long as hindi bumababa yung rate of cesarean, hindi namin iaakyat ang bayad namin na 19,000. So yun po ang mga ibang consideration. It's not only the costing, but how we are able to change behavior. And admittedly itong cataract, after we've tried all of these investigations, itong mga staff payment, etc., eventually our last alternative here is simply to go after the rate. Maybe to cut it down to such an extent.
That's precisely what I'm driving at.
Correct.
Pag-aralan ninyo how you design these payment systems for different types of surgery or healthcare.
We will, Senator.
Okay, thank you very much. Thank you.
Dr. Kalimag of the Philippine Medical Association.
Thank you very much, Your Honor. What I would like to say is that perhaps may culpability among the practitioners, But I think at the end of the day, we should try to look at the system in PhilHealth also. Because sabi nga ni Attorney Padilla, through the cutting of claims, they can actually modify behavior of the practitioners. Pero hindi po kasi yun eh. Ang nangyayari po kasi, iba yung tinuturo namin sa medical schools. Minsan, iba ang nangyayari dahil ang reimbursements are catered only to a certain type of cases. I think when tinanong na po namin yan kung paano ba talaga nakuha yung case payment scheme. Kasi like pneumonia, for example, which is a medical, meron siyang certain amount. Samantalang yung surgical procedures, like appendectomy, for example, is 24,000, yung pneumonia severe is 32. It seems like the total amount of reimbursement sa facility ang tinake into consideration without taking into consideration also the risks of the patients at saka yung risk ng doctor in trying to perform the operations. Halimbawa po, yung pneumonia severe, you may only have one doctor there at 32,000. Samantalang yung 24,000, for example, sa appendectomy, meron kang 60% niyan because it's surgical. May anesthesiologist ka, may surgeon ka dyan, meron ka pang medical practitioner. Tama po yung sinabi din kanina na siguro naaral na yung system kung kaya't minsan sa private, nafa-facilitate nila yung reimbursements. Sa public, I've just been to Leyte. Ang sabi nila, dun sa kanilang PhilHealth na facility, sinabi na tambak pa rin daw talaga yung mga reimbursement claims na hindi nagagawa. So humingi pa daw ng tao doon sa mismong mga public hospitals kung pwedeng tumulong sa pagpaprocess ng mga claims. So ang sa akin po, I think na we should look at the system, we should look at how policy is done. Kasi po yung policies, sabi po natin, kailangan, kumbaga parang mag-scenario plan ka na before mo palang i-implement yon. Saan ba pwedeng magkaroon ng abuso dito sa pulisiya na to, sa policy na ito, bago pa siya i-implement? Kasi kung iisipin po natin yon, magiging proactive po tayo sa PhilHealth instead of reactive. Kasi ngayon, iintayin pa muna nating mag-balloon yung mga claims at saka makakuha tayo ng trends bago natin sugpuin, di ba? Samantalang kung inisip na natin yung mga possible behaviors bago pa lang ito i-implement, maipapipigilan natin yung mga ganitong, di ba? Well, sabi nga natin, everything is driven by social things, no? So, isipin natin na kung siguro sa one of the things that will drive reimbursements talaga is yung economics, no? The economics of things. Pero importante na aaralin natin to before and not after. Kasi nangyayari, there was one time tumaas ang claims, for example, ng I think typhoid fever over dengue fever. Tapos nalaman kasi na mas mataas pala yung claims for typhoid fever than dengue. So ngayon pinagpareho na nila. So ngayon okay na naman yung totoong trends na ang lumalabas. Yung mga ganong bagay. Dati po kasi mas maganda dahil kasi talagang ang claims ng mga physicians, yun po yung sinabi ko last time, na magkaiba po kasi ang claims ng physician at saka ng institution. Kasi pagka po ganon, talagang naibibigay ang karampatang tawag dito, reimbursement sa doktor based on the risks of the surgery, risk of the patient, risk of the physicians, and all of those things taken into consideration. For your appreciation, Your Honor. Thank you very much.
Okay, thank you. At this point, we would like to state that marami tayo na take up ngayon. One would be yung karapatan ng mga pasyente, yung issue ng patients' rights, which I'm alerting the Department of Health to include in their facilities audit. Not just the facilities, instruments, not just the doctors, but also the compliance with the rights of patients, the right to be informed. so many of the things that they should be informed about. Pati yung issues tungkol sa yung sinasabi ni Senator Recto na bakit nga naman pala mas marami ang napupunta sa mga private clinics kaysa government. And layunin talaga ng PhilHealth, tulungan ang mahihirap. Pero yung mga local government hospitals, mga hospitals run by the provinces, by the cities, are getting less from PhilHealth, and private clinics are getting the lion's share. Another thing is the case rate system. Bakit ganito ang nababayaran sa sa katarata? Bakit ganito ang nababayaran sa panganganak? Ba't nagkaganito? So we're starting to question the basis of everything. These hearings will continue. This is not the last, and I'd like to reiterate, especially those whose names have been mentioned, whether institution or persons, we will give you all the opportunity to air your side. The hour is late, so let's end it. I think the rains are coming, so let's suspend these proceedings. But before we suspend these proceedings, let me end it with a pleasant advanced happy birthday of Attorney Alex Padilla tomorrow. Happy birthday. This hearing is here. We will announce the next hearing. This hearing is hereby suspended. Thank you.